Good evening, Trinidad and Tobago family. So we are here with Farida Ramnat, who was here previously on the program, and she had some issues with her mother not being taken care of properly initially at Mount Hope
Oh,
when the PNM was in government, and they caused some damages to her mother, and also at this point where because of the negligence the situation reached so bad where they had to actually amputate the foot now. So Farida, just want you to give a little breakdown on what was the how this thing initially started, and then you can give us like how you told us before what took place with the IV and everything, so those who don't know.
okay. Well, it all started with her toe getting a little blackish, and we've been going to doctors, private, and then eventually it start getting. They said it's a circulation problem. She
Mhm.
had some issues with varicose veins a couple of years, well, about over 30 years ago. But she used to move around, and it was okay until recently, like the beginning of January, it all started. So then, when it start getting progressing a little more worse, and we took her to the hospital in Mount Hope. That is where all hell break loose. So they kept her there. They damaged her hand. That's when I called Mr. Gary. The day I went to see her, that's over the Easter weekend. They haven't done anything. I think the week before they had put a stent on her, never give her anesthetic for it, and then they had her in the ward again, and that's when the hand damage, and they had her in an emergency for 3 days without doing anything, and she can't get up for herself. She couldn't go to the bathroom. They never cleaned her anything. And when I went, I said, "Look, I need to clean my mom because she's geriatric, and I can't leave my mom like this. Been sitting there with the swollen hand. They said they can't do it." And I said, "Well, okay." And then I left. Well, they put her in a ward, and then the next day they sent her home with that hand. Didn't do anything to it, and we had to rush her to San Fernando Hospital where they had to take care of it and cut right around it and stuff. It was so bad. The hand started to get decay. The doctor told us in San Fernando. So, but she still cannot use the hand properly. It's still sore, but it's much better. It's I would say it's like 90% better. But she
So
still
it's
have like
because they put
break.
that. I remember they put the IV in the wrong place, and
Right.
they caused damage to the flesh to the extent that where the flesh had to remove from the hand, right? And
Exactly.
for example, right?
Yes. Yes. Although
So,
she was burning her and stuff, she said she was bawling, and they telling her no, that okay to go when you go out back there. They will put ice to let them put ice. They don't have ice and stuff in there. The condition of that place when I carry my mom, well, I had to beg one of the nurses. I said, I need to clean my mom. I can't leave her sitting here in these clothes 3 days now. And she's sitting on a wheelchair in the emergency section.
not getting attended to, right? So she
They
spent basically, as far as I remember, she spent about 3 days waiting for help in that situation. Then we went live, and then we had to reach out to some people before we could get some attention
right.
to her. But and also remember they said that the nurse who they have no record of the nurse who put the IV in her hand.
Yes,
They can't get
yes. When
up
I
to now.
asked, yeah, this when the next day they wanted to do it again, she said no. Objected because the condition of the hand. I sent you pictures and stuff. It was swollen. It's like it was so bad. Like if you touch it, it's gonna burst. And then we carry her to San Fernando where they corrected it. We stayed, spent the night there. They were very nice in there. I must say, San Fernando and Port of Spain, we had good um thing with the doctors. Even the people that work in there was very nice. It's just you had to wait, which is expected, but they were very nice.
But my concern is in the initial stage of this foot, for it to reach this stage, what it is happen? Refresh my memory. I know you said something. What is this happen initially for the foot to get to it at that point? I know you said something about the veins, but what did they did a procedure, right? And
They
they
did
didn't maintain the care of the procedure. Isn't that what it is?
no, right. We keep going and they keep telling us come to the clinic, have a waiting whole day there. Okay, come back in next couple months, you know, and nothing doing. So then we tried Port of Spain. We went we had this doctor give us a letter to go to the specialist in Port of Spain. Look, I can't even call the guy name now. And he saw it too. He was very nice too, but they keep she has to go back for dressing and only dressing until eventually it reached a stage where my mom like she got a stroke and she couldn't move anymore, so we couldn't take her because she couldn't sit on wheelchair and anything. She has improved with sitting on the wheelchair for a little bit. um I and my brother, we just have to take her now, um and hold her in a sheet now that the foot is amputated, and lift her to put her in the car. And then when we had to take her out of the car, put her in the wheelchair and prop her with pillow and stuff to go to clinic. So physically she it's bad, but mentally she's pretty okay.
Suman,
Good.
Ken, you guys could ask any question already.
Yeah, something just popped across my mind there.
Yeah, this is a
Um, yeah, I know in the US, the social services and stuff, they would have a special bus with a ramp
Yes.
for wheelchair access and so forth, and they would assist you. Now,
Right.
I don't think we have that service level of service in Trinidad. And Gary, something to probably ask Dr. Ramrup if we could tie in that in the proposal also, because there are many people who are not mobile and they need medical attention, right? And we have a classic case here with your mom.
Yes, and when I
you
go to Port of
see,
Spain, I see many cases, which is
Mhm.
very heartbroken.
Because if you guys are not able to maneuver her, then she's stuck, right? So you
Yeah.
said you and your brother have to pick her
yeah,
up in a sheet,
Yeah, yeah. So
right? I mean,
this is what Dr. Ramos was speaking about retrofitting the home and
Whole
making
yeah.
accommodations,
this
to
is
right.
the thing. That's what I was going to say, Gary. This is this UNC campaign on the people-centered government, right? And we still need to go out in the community, find out the aged person who are handicapped, disabled, who
Exactly.
cannot go to the drugstore, the pharmacy, even the health
Right.
center, but bring these services to these people at their homes.
Yes.
Because
Correct, correct.
it I can tell you it takes a lot of effort from a family to
Yeah.
go through this. If suppose the brother is working or the brother is not working but got a 10 days or so, how is he leaving that now to help this lady here?
Mhm.
Well, and
You
the
see,
thing is, I'm a single person. My husband died like 16 years ago, so
mhm,
I have to survive.
you have time. You may
Uh,
have time on your hands, but everybody is not in that situation.
Yeah,
no, I
yeah.
So you
have.
see, it,
I work. When I do geriatric, so I right
mhm,
now doing couple days. You know, so I have to
right,
work.
right.
Yeah, work. I don't get paid because I have no way like to upkeep me or to support me. My husband died, and I mean I do have children. It's me alone. So and I'm grateful for where I'm living. My mom,
It's difficult.
yeah. So I try. We try to do our best. And I being in this
Yes, yes,
profession,
yes.
um, and not for my mom alone. I try to do it. Even I go to the San Fernando General Hospital a couple of years ago, and I was trying to assist this lady who was actually blind going to the eye clinic. Her son dropped her off, and he went to park because there you cannot park. You have to drop them off.
Hmm.
And the lady, so I try helping her down because I went to the clinic myself. So I said, Auntie, she said, can you help me put my card and whatnot? So I really do that. I went and I take care of her. I didn't mind losing my appointment, you know. So because I have a passion for it, for taking care of geriatric people. And she wanted to go to the washroom. Well, this was on our next scenario, and you have before the lady reached to the washroom, she pooped on herself. I can in my thing, I couldn't leave that lady like that. So I tell the caretaker, I said, look, so and so is the case. She said, well, we don't see about that. She said, go to the nurses and them there. When I go to the nurses and them there, they watching me like, they're not taking me on. I said, well, okay,
Mhm.
give me gloves and a pampers and I will do it. And which I did. I clean up the floor and then the cleaner assists me. I clean up the lady, I put on the pampers for her and she got her appointment and her son came for her. So
Wow.
I said, look at these people, you in the hospital, that's your job, things like this do happen and still nobody really, and I was very disappointed though with the nurses on them there for that.
And
Mhm.
Gary, this is what I continue saying, boy. All these systems, these procedural systems, they're all broken. And these things have to be re-engineered. And the ministers have to take a keen note and fix this priority, not only in health, and a lot of ministries, the procedure to get things is broken. Sometimes you go, you get service, and sometimes you meet an arrogant person and they don't care.
Of course.
They do not follow the procedure because the systems are in place, but the procedural side, this is not my responsibility. This is not my job.
Yeah.
This you get all the excuses,
They're not even
you know,
interested in doing their
and
job,
these things.
because there was nobody to hold them
Us.
accountable. You
No.
That's
know,
right.
This
Right.
is
Right.
the thing, and
that's why that's
at
why we
the end of the
reach.
day,
Yeah,
the KPI
Um.
is the key performance
Yeah.
indicators where you're supposed to assess the officer every year. And you
Yeah.
know what they do for PSS and so on? They have so much backlog, they tell you, fill out your own and bring it for me, I'll sign it.
Hmm.
That is the way it's done right now. You filling out your own performance appraisal and they will sign it for you. And
Fine.
that is how the PS
So,
shirking their responsibility, you know. And they're
And
the ones
that's
who's supposed to assess you.
yeah. And that's why the
Are
level
you
of
coming
service.
on time to work? Are you leaving early?
Yeah.
Are we getting complaints about you? And
Yeah.
so on. These things have to be assessed, but no one is doing these things. So
Yeah.
this is why the public says service is where it is.
it had
That
an
was the next
You
point.
know,
The
there
level of
was
service continues to drop.
there was
Across the board.
one
yep,
incident when mom was at the
across the
hospital.
board.
There was this lady who came for vacation with her mom, and her mom had cancer. So she was
Mhm.
next to my mom in the bed. And the way they treated that woman, like, they know she had cancer, is like, how, no, they didn't care, they know you're dying. Like, well, boy, that woman daughter came and she let them have it. Doctors, security, everybody, nurses. And she hired an ambulance and take her mother straight to the airport and back to America.
Yeah,
Yeah.
And she was a
that's a
nurse.
14th one.
She was a nurse. She said, we don't treat patients like dying patients like that. Yeah, you know. Boy, they couldn't tell her anything. She give it to them good and proper.
But you know what? I am sure in the nursing fraternity, they are not trained like that. They are
Uh,
trained the proper way, because the same nurses will go away, UK, US, and Canada, and so on, and do what they have to do in the right way.
But when I was training in Port of Spain Hospital, when I was doing my course for geriatric, when we go to the hospital and the to get stuff to clean, they don't have any cleaning stuff in there. So one of the cleaner, I say, where is the liquid to clean the patient and whatever and so on forth. He said, child, they just teeth out everything, boy, and
Wow.
just go away with it. And
So you
in
see,
this incident in San Fernando, they have, when I go to clean my mom, right? They have plastic buckets you have to use. It's not stainless steel and whatever. Some places have like stainless steel bowl, but San Fernando have those buckets, like them paint buckets. That's what they give you with water to and plastic cup and bowl to brush the teeth. I carry disposable bowl and stuff
cups
because
and
they're not you don't know if they're washing it then there.
correct,
But
correct.
bucket, so I was
So you see,
disappointed.
the systems it's all broken. They don't care. Sometimes they work with what they have. I mean, at least you got a cup of water in a bucket. But what happens, if you cannot meet the minimum level of care, and this is what, and they don't care. Nurses, some of them just don't care, man. They
But
come.
do you don't get water in the hospitals there? Here? You have to carry your own water and stuff. Like to drink for patients and stuff. You have to
Uh,
you have to carry your own water.
So what improvement have we seen within the last couple of months? Any kind of improvement at this point? Or
You mean for
since
my
since since
service
the
wise,
UNC
service wise.
took office within about 6 months, and any slight improvement you have seen so far, or we're not there yet?
um I seen there's a improvement with I mean the nurses and them are a little more pleasant. I mean so far
Yeah.
and they were very you ask them like if when mom was in the ward there um they will assist you because I was scared surgery to clean. So they said no, they will clean her the first day,
Mhm.
And
but
that is taking place because UNC is in government at this stage.
I think so. And you know how they do cleaning there? They My mom wasn't there for a couple times, right? And when they put on pampers, they put cotton, a set of cotton between them because to soak up the urine so they don't have to change pampers regular. And you know what too? I think the improvement you get in pampers. They give you pampers there. And it was a good brand. I was very impressed.
So we are seeing some improvement at this stage, right? I know it's going to take some little time, but
Yeah,
I expect to see
but
some kind of an improvement.
I was really impressed when I see the brand of the Pampers that they give because that's the one we buy for my mom. Um,
Mhm.
Evoy. That is a very expensive Pampers.
And
Maybe.
also, we have seen some improvement with the medication quality,
Oh
right?
yeah, yeah.
Yes.
I can vouch for that because I got a list of 4 medication where
Yeah.
Dr. Boyle told me that they have got in. One is Plavix, that is for stroke and heart patients. That's an
Right.
expensive
That's
medication, even in the
bad.
US.
Yeah, that's an
E-
expense.
Even in the US, and so now they're giving that to stroke and heart patients. There is a high blood pressure medication, Lovastin,
Starting,
which is
yeah.
a mixture of amlodipine and calcium channel blocker, like Novask. So those are two expensive medication. One's a diabetic drug, and the other one I can't recall. But the lifestyle disease scenario with the heart and diabetes and high blood pressure and so on, they have changed the formulary, and they are or they have the new medication in stock already.
Oh, okay.
Yeah, so that's a plus. I mean, a good sign. A lot of these things were outdated. Some, 18 million was had to discard it, expired. That means people were either hoarding these things or they were not giving it out. how you could have expired drugs and people ain't getting medication. Something has to be wrong with the system. The system is what I always say is what is tarnishing the image of not only health but a lot of the ministries, because unless somebody from above needs to put their hand on the system, redo this damn systems, man. Have the procedural flow of things. When step one, when somebody check in the hospital, this is what you do, that is what you do after, and like that you go down the line. This lady should not have to complain and ask for someone to change her mother or her friend or whoever it is. That should be standard operating procedures.
Exactly.
Yeah.
Yes. Yes. It's not for my mom alone, but the kind of patients who's coming in, it is
Yeah, yeah.
But
It's a
When I-
SOP.
I mean, you guys remember recently I had a gentleman who had a heart patient. There was 3 days in the emergency room waiting for care, right? I mean, to have people sitting on a wheelchair, and I think 14 that your mom had her own wheelchair this time, right? Yeah, and you ain't getting in my
Right,
wheelchair.
but I had an experience
Mm.
last year August. I got dengue so bad, really really bad. I was losing my memory. Um um my brother took me to the health center and I went private because it was a holiday, and I so didn't want to go to hospital. As the So I had to end up going Shaguanas. They told me, well, from Shaguanas, you have to go Mount Hope, but if we have our own vehicle, they have no ambulance. So my brother had to drive me to Mount Hope. When we went to emergency, and his daughter was in the children's section that day, so his wife had to be with her, and he had to be with me there. I sitting on a chair, a wheelchair. He took me inside because I could barely walk with my
Frida, I
bag
don't know if you
because
could
look,
change your
you had to
location or something,
leave
but
me
the
here, and you go
internet is
home and
running a
see,
little low there.
took the wheelchair for me. I said, can I call? We just get some bad connection where I live here. Metal chairs, long time had a metal chair that curved, and I can't sit, I can't keep my body up. So I asked the security, I said, can I call someone close to where I used to live, because they have these camping beds, like them cut, so I could get one to come here because I can't sit up, I can't vomit it, They said, no, you can't bring it, nobody can bring anything for you. Well, thank God, after the late, very late in the night, they called they took us to Cuba Hospital. And oh my God, that was like heaven. I was in that hospital for 8 days, 24 hours drips. But it was so nice there. The doctors, the nurses, place very clean, you know. Every shift
Are you referring to the
mopping,
new hospital that was
Yeah,
built?
yeah.
Okay.
Yes, hospital. I was so happy that I went there. It was really, really good. And I stayed there for 8 days. I didn't know
Sometimes
dengue was so bad.
yeah, sometimes you go and you get good experiences, and no two ways about that. And then sometimes you go and everything is a hassle. It all depends the attitude of
Yes.
people, attitude of doctors, nurses, lay administrative people, and so on. But they are, as I said, they are standard SOPs for these people to follow.
Yeah, I mean, but listen, with all the training you give people, if you have nobody to hold them accountable, if you don't
Accountable.
have a
Yeah.
structure in place that is holding people from accountable from the administration, where it's enforced, it's monitored. You could give them all the training in the world, and you're not
Correct.
going to get anywhere, because
Correct.
but there is a culture to
Yeah.
this is a kind of culture among
Yeah.
our people here, to be favorite to one another,
Yeah.
other person, and you have to know somebody, and you have to bribe somebody,
Yes.
this kind of nonsense. But this is something we're going to change. By the hook and the crook, we intend to change this.
Yeah.
And those of us who live outside the country are demanding that this kind of system change. That's why
Yeah.
we are assisted in changing of a government, because we don't want the same status quo. We want
Correct.
change. We
Correct.
want improvement. We are willing to assist, right, Ken and
Yeah.
Suman, because
Yeah.
Yes, of
these are the
course.
things we want.
I
Definitely.
know.
And Gary, just to add to what you're saying there, I think there's a need to pick up the qualitative data from the
Hmm.
end users and have a well-tuned, a well fine-tuned system where we
But you,
collect that data to make the assessments, right?
yes, Ken,
Because
I
there's a
agree with
disconnect
you.
there.
And I could give you an example. I was in the hospital for 4 days in my back by lumbar fusion in Mount Sinai, and I could tell you 2 of those 4 days, so that's 2 days, you had a quality assurance person coming into your room.
Yeah.
Is everything okay? Is this start with the food? Is the food to your liking? What can we do to improve the situation overall here? The nurses courteous and so on. They doing what's called an exit survey, and that is
Yeah.
so nice. So you can list all your complaints to them, you know, and they will make sure that your situation is taken care of within a certain time frame. And I was blown
Yeah.
away with this kind of
Yeah.
service, you
Now,
know.
Samad, I think we should have a database, right? Where you could, when you get home, you put your patient number in there, and that will reference your record. And then you can state all of your experiences, from the food to the level of service, right? To whether they were timely with your
Mhm.
medication, whether we had any complication after you got released from the hospital, you
Well,
know.
I don't know if you know, Ken, but when they come 2 o'clock in the morning by you to draw blood, that is recorded on your the nurse walks at the computer station with her. The
Mm,
rolling cart is like a rolling cart. So they timestamp every medication that's given to you. It has a time and it's stamped. At 4 o'clock in the morning, they come, they make sure, you have to take this medication. Okay, they check at 6 o'clock, they check your urine in your container and so on. So everything is recorded, and it has a printout sheet you get when you leave the clinic there, or the hospital, as the case may be. Every
Just
single thing.
imagine they can't
What
give account
time?
who put that IV in her hand. They can't,
Exactly. They
you know.
couldn't. Yeah, because they
And
know this.
we
But they
should
know
not let that go easily, you know.
this is
Yeah.
medical malpractice, my friend. Medical malpractice.
Another bad
You know.
experience I have in Mount Hope also is that in emergency you cannot go in like San Fernando. When my brother and I we go, they allow one of us at a time to go. Like when he go in and come out, I will go back a little while after. We take turns. Um, but in Mount Hope, oh my God, the security and the people at the front there, oh my God, they give you a real hassle, and they're very ignorant. They talk to you like if you are dogs, stray dogs.
And that has been happening recently, or has it changed
Um,
recently?
well, I haven't gone back there since
Okay, because they have a
um,
new board, a new chairman of the board, a whole new system in place there at Mount Hope. I know
and go
because.
talk for the receptionist at the desk there to
Hmm.
register. Boy,
Hmm.
she yell at people, and people come with their hand I came, and she said, well, you have to wait 12 hours because I have no doctors to see you until after 12 hours. I was like, oh my God.
Ay, ay,
Every
ay.
patient come in there, I'd had this lady couldn't even breathe. She have her sitting there. The woman, like, she was ready to cap.
I think they call breaking up a little.
I think she dropped out. Go ahead, Suman.
Yeah. No, I said these things is really SOP, standard operating procedures. There's a
Bring it
protocol
back
to be
in now, Ken.
followed.
Yeah,
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 yeah.
yeah, yeah.
I got bumped out there.
Yeah. I
Yeah,
noticed the interrogatory.
yeah, they have these standard operating procedures in any given situation. They know what they have to do. So by not doing it, you become liable, and that is why hospitals are different from hospitals here, because you know one bad operation, one bad injection, you know, puts the entire hospital chain, the ownership in problems.
Correct,
You know,
correct.
their quality assurance have to be spot on with these things. You don't want to get a complaint like, oh, I didn't get water in time. I called the nurse 5 times. They come in, and they reach out. Like these kind of complaints. This is just simple things like water, but things like serious, like what time or how quickly did they attend to you and so on when they pop in there. These things within 15 minutes you have to be taken care of, communicated with either yourself or your family to let them know what is, oh, the doctor is coming, they're going to wheel you in the next 10 minutes or so, things like that. So they keep on informing you. But here you do not, according to what this lady is saying, the only information she's getting from the attendant is that we had no doctors, we had to wait 12 hours, and you have a cut in your hand or foot or wherever. What kind of stupidity is this? But
You see, the thing about it is we 60 or 63 years now in independence, and there's
mm-hmm.
a lack of respect and recognition of the citizenry, in the sense that your citizenship does not you're still being treated like a indentured laborer
And this is exactly the
or a
point.
slave, because this is the way our people is being treated. So this understanding has to come now from administrative level, from the government top down, of what the expected expectancy is from and then you have a complaint authority where or mechanism in place. Well, we know here we have customer service, customer experience, that they fill out a card. You could have that card. I would suggest that information is electronically documented, and don't fill a
Yeah.
card, because they could take that card and throw it away. So now, if you electronically document your experience at the hospital, that goes to the ministry, and the complaint is registered. You know.
And Sumad, now with AI and stuff, we can get a lot of assistance with all of that,
Big
right?
time, big time.
It'll make it
Just,
much easier, much more efficient.
boy, I was, it's good because I did my
But,
AI in
but,
health.
but Ken, this is all the things we've been talking, before you
Yeah,
join us. These are the things that we were talking about putting in place. This structure, what I tell Suman to put together for we so recently there, right? Is is exactly what we've been talking about. Setting up the structure for all these things. Suman has the whole general plan together.
right.
Boy,
And now we need to get that implemented.
so you see, and again, this is not about bashing anybody, man, but
No, absolutely not. But it's
no,
about putting
is
people
about
first.
improving the quality of service meted out to
Correct.
people. That is the important thing. I mean, why do somebody go in a health center or nursing? Because they're sick. They have a problem. Some problem they have. And
But there's that total lack of consideration. You
that is the
understand?
Yeah.
point. That is the
And
point.
you may here and there you hit and miss. You might find somebody, but you're generally treated like cattle.
You're third
You
class
understand?
citizens. Some
And
people.
I would not go for that. I mean, I tell you, I had an experience with my mother, where a speck of dust went in her eye, and I had to go to 3 or 4 different places, just to take out that dust, and they mishandle it, and they want to give her an injection for sugar. We didn't come there for that,
Mm.
and then we ended up in St. Joseph there, because Mount Hope couldn't handle it, and the guy seen me wearing a Bank of America shirt, and right away he started to talk money.
Well,
Yeah.
that's our next issue with those nursing homes.
Well,
They
nursing
want to
homes
send you
are
by
what they
their
are.
friends. Yeah, they want to send you by their friends and stuff, and they just demand um I have a friend who was telling me about that in Southern Medical, where he has cancer, and his daughter is um something with welfare thing, with the medical thing,
Don't call
and
no names. Eh?
yeah,
Don't call no
yeah,
names.
no, okay, and the doctors he was seeing insist that he go to her people, and he said, no, well,
Hmm.
I getting it done, give me a letter to go to the hospital. And
Hmm.
she wouldn't give it to him. She said, no, you have to go here, you have to go to these people, and it's so much and so much $1,000. And he was drained out, and he had to eventually go to the hospital because all his money went going there doing stuff.
That's
And they had a big
another thing with
argument.
this.
A
Yeah.
quick
He had a
question, you
big
guys. I don't
argument.
know. I mean, I left Trinidad more than 40 years, right? So, do we have like a medical do you complain to the medical board? Is that where you file a complaint? How do you file a complaint with the in Trinidad? What's the structure there in place right now? I know we need to upgrade, but what is the current structure? You guys know?
I have no idea what it is.
I have no idea. I know at Cuba Hospital there's when you go there and you're waiting, and I think there's a number where you call, even in Port of Spain, for the you can call and say if you have an issue, but I don't know if you get through with it or not.
You see, there's a violation of protocol there. Then you're left in the dark. You have to deal with that yourself, right? And there's
Yeah,
no
but
structure in
Exactly.
I,
place, right? If
I
there's no
but
structure in place to forward that complaint, right, to a certain statutory body independent statutory body who could handle that, right? Now, someone and anyone else, but when was the last
Mm.
time you hear a doctor got sued and had to pay a patient for
no,
malpractice,
there's no
right?
malpractice
So,
here.
so they
This
get away
is
with every and anything,
correct.
I think
Correct.
our prime minister said she was bringing all these things into play, So, coming forward, where you can file a lawsuit and things like that, the complaint.
well,
Yeah.
more so, we need to disband people also from the practice if they don't want to practice and they don't want to bring that level of care, right? That is that's in the standard.
And if
Then
you
you
have
shouldn't
a
be
private
practicing
practice
medicine.
and you are working in the public system, you need to be loyal to that public system when you're supposed to be there.
Yeah,
Correct.
but
Okay.
Gary, you know the run of the mill how things operate.
Yeah.
You know,
Everybody have a partner and they partner this
it
and they
will.
partner that. Yeah.
Well, no, I can give you personal information if I'm a specialist and certain. You get an appointment next year at this time, 1 year off.
Hmm.
Let's say eye surgery, right?
Yes, exactly.
One 1 year. But I can, you know what? Come in my private practice, and I will take care of it next week for you. So this is
Yeah.
an offering which is made to the patient in a lot of sphere. You have a problem, they know that the waiting time is next year, at least 1 year from now. Come into my private practice, and the same
But
doctor who is
far as
saying,
I'm concerned, by the hook and the crook, they have to change.
boy,
They'll have
Yeah,
to
yeah,
change because
yeah,
they will get pressure from this end, from this platform right here. The minute I get complaints, but anybody, we coming after you.
yeah.
We
Definitely,
coming
definitely.
after you. I'm telling you right now, we coming after you.
especially in emergency situation, what do you want? Somebody could get blinded and they come to you if somebody needs a cataract or surgery or something, man. Come on. People have
I've
to
been
get the
going to the face. Yes, yeah.
MRIs and CAT scan and so on. It's 6 and 9 months out. So if they don't have money to pay for it privately, what is the situation?
So
Even at
man,
the even at the health center, if you go and well, I in the health center since I was sick with got sick with the dengue, they joined me in the clinic there, and to do a blood test is like 2-3 months. You had to wait.
wow.
You
Yeah,
know.
and I told you I joined the health center here when I came back recently, but I was so shocked.
Yeah, you give you
Everything.
like way long. I mean, it's and so many old people go there and have to sit and wait, and oh my God.
Yes, it was a good experience for me here. I should
Mm.
have done this one instead of Mount Sinai because I did the same thing in Mount Sinai. I did my AI projects in healthcare in Mount Sinai Hospital. So I know basically the flow, how it is operates there versus the flow, how it operates here. But surprisingly, when I went to the register in the health center about 3 weeks ago, one of the first questions, they were, why didn't you do this before? And so they wanted to try to probe why were you away? And if you're away, well, you can, if you need
Afford. They can
medication,
afford. Yeah.
you can go and buy it.
But they
This is
usually
what
do
they're
that,
trying to tell you.
They
This is
usually
what they're
do that
trying to tell you.
when you're at the health center or you go to the hospital. They give you the basic medication, and the expensive one they tell you have to get outside. They don't have that there.
Mm-hmm. Mm-hmm.
I don't know for
So,
now, but I mean,
so
with my mom experience, we get.
yeah. So I just went to see the doctor. My wife is also a doctor. She's a senior registrar in Tobago. But I went home now quite about just for a short time. And when I went to the health center, I had to register. The doctor is probing me and say, well, you know what? I have to I take a certain medication called Brilinta. He said, well, we cannot give you Brilinta. You have to check in here into a nursing home and let your doctor recommend it to us that you have to get Brilinta. And we will write a prescription for you so you can buy that on the outside. So I had to spend $5,000 to spend a night in a nursing home, basically to get a prescription. When I could, my phone
Oh my
here, I can check in my chart, which is the hospital, Mount Sinai, and look at all my medication I get, and print out that list and take it to them and show them, hey, you know what? I have to get a high blood pressure medication. I need to get sugar medication. I need to get for my stroke medication. I need to get for my dengue medication and all these thyroid, whatever sicknesses you have. But they cannot give you no medication unless you visit nursing home, especially and let the doctor recommend what medication you are taking in the US, for example, and they will look and see if there's a comparable medication here. But they cannot give you that medication unless they get that letter from your nursing home or whoever it is. So that was a good experience for me. I never knew that. Thank God I went and I saw that, but I really don't need anything because I'll fly up to Miami every 6 months and collect my medication. And I said,
Mr. Gary, at one point I want to make it it's not really a medical issue, but the pension situation here, right? We like every year you have to go and sign up to renew the pension to get your pension. So my brother went into Shogunas because we have to go to Shogunas. So we told the people them that my mom, she cannot walk and it's difficult to bring her and thing there. Do you know what I told my brother? Get an ambulance and bring her. I was so surprised. I thought they have officers to go do that, come visit at the home.
So this
And
is
nobody
the
never came.
social service told you
Yeah,
to get an ambulance and bring get the
Yeah.
name of that person and you'll send it
So,
to
well,
me.
I will have to go back again because
Yeah.
I mean her
that is
pension
BS,
came in.
man. Total BS.
It's coming in, but I was surprised they're supposed to have an officer. I know
Yeah,
usually
well,
it's
I want to
officer.
remind these people that Kamala is Prime Minister. Let's remember that. Kamala Prasad Bisesa is Prime
Yeah.
Minister. Let's get that name straight in our head,
Yeah.
okay? And
know,
UNC is the party
But Gary,
in government.
I'm telling you, they sort of profile you before.
So they got to clean up their act. I tell you, they got to clean up their act. We coming after them.
They sort of profile you before, and if it's not one of their so-called kind, you can afford to pay for it. They kind of tell you that in a way, indirectly, that why are you here? Why are you here? You need medication and you have your Bank of America GC, but you do what you have to do and get it.
we have our sister who is Fazia Khan. Farida, I don't know if you ever met Fazia, but
Um,
she's a nurse in Canada.
I think
Uh,
so. The last
yeah,
ones,
yeah. I
I
think you
think
must have had a little
a little
interrupt.
brief. Yeah,
Yeah, something happened there. Fazia dropped out. I don't know. Fazia, I don't know if you're hearing us. Your internet seemed to, you dropped out there a little bit. So anyway, yeah, something went wrong with her internet. She's gonna have to come back in. Yeah, guys, go ahead,
yeah.
talk on
But
the minutes
they need
caller.
to really, they really need to do that because it have a lot of people who really cannot move. They cannot get people like a vehicle to take them, and to go to
So,
get these things just
yeah,
signed.
and
They should
and
assign
that would be
a traveling officer to come visit you.
yeah, and that is
Correct.
where the standard operating procedures would come in,
We
right?
got back Fazia. We got back Fazia. Okay. Oh, what happened? Something's wrong with her internet. She's popping in and
Oh,
out. Yeah.
yeah,
Yeah, but UNC has to keep up and maintain their manifesto promise. People send to the government, do whatever they can do, the various ministries and so on, to
yes,
make sure that they make life as easy as possible for
Well, the
people who are.
complaint has to be documented. The complaint has to reach the attention of the ministers so they are
Yeah,
aware. And always get the name of the person that dealt with you in the wrong way, so we know
yeah, yeah.
exactly who it is, and they can be addressed. You know.
And Gary, I think
right.
Miss Farida's testimony is a very important one,
Yes,
because
You can't,
that
yes,
can't
is
just imagine
yes,
her mother wasn't properly taken care in the first place.
yeah,
correct.
Then she gone to the emergency room and sat in 3 days on her, fortunately, her own wheelchair, right? And been neglected. And we had to make some noise. And she contacted me and we had to go live before she gets her attention. I had to make some calls. So it
yeah,
depends on who you know. Every citizen should be treated equally as they
Exactly.
enter there. They don't
correct,
have to know anybody.
correct. Yeah, correct.
And this
And
damn nonsense had a cut out in
yeah,
Trinidad. You don't have
uh,
to
uh,
know anybody.
and that's why
Exactly.
we should probably use her testimony and her case, right, as an example of what we do where we don't want to end up again, you know, so that will be
Exactly.
a teaching tool moving forward,
Yeah.
right? You know, and I think once people start to see these cases, they say, hey, you know what? That is a lawsuit right there.
Okay.
We don't want to go
So,
down there because now you're going to be held accountable, right?
I
But we have to
this
have
is
something to hold them to, some sort of standard.
and
Yeah,
that
it
is
had to
what
have some kind of a complaints authority. It had to have some structure in
A
place in the
medical complaint
various
authority,
ministries,
Mhm.
in
you
the
know, some
various
kind of
ministries.
a medical complaint authority for all the
Yeah,
ministries,
yeah, we need that. Definitely need that.
right? You
For
build a
not
road for
only that, for
you,
all, entire public, every ministry should have that.
yeah, you build some infrastructure, it's not
Yeah,
functioning properly, or it's not working for you, it's not user friendly, it's
but
dangerous, etc. And you voice your complaint. So we get the qualitative data from the end users,
I
and
mean,
now we
we
make the
know when you
assessments.
get when you go to a doctor here, they look at what medication you are taking before they give you any additional medicine, and they will
Yeah,
and even between the doctor and the pharmacy, you guys know that they will let you know that something is not compatible with
the
something, and if you're going to do
interactions,
certain thing,
the
yeah,
drug interaction, what it
yeah.
can cause. Yep.
But in the Trinidad they could give you anything, and if you're dead, you're dead. They look like natural cause. It doesn't mean none. It's not natural
Yes.
cause. It's because a
Right.
reaction to
Yes.
something.
they don't know if you're allergic to the medication or not.
Yeah.
Correct.
If you're
Right.
allergic to penicillin,
Another thing too is these eye specialists too. If you go to them, they don't give you a prescription. You have to pay for it. I experienced that and my mom, and they don't give you it because you have to go right there at their
Something
glasses
was wrong
place.
with your internet, Fazia. You were dropping in and out.
I know it was my phone, so I just got to my laptop. Sorry
Oh,
about
okay,
that.
okay. All
Good.
right.
Good.
Yeah. So
Good to see you.
Nice to see you guys too.
I'm relaxing.
nice to
I'm
see
at home. I'm at home, so I can relax.
Yeah, I just got home from work. Just
so
got
Yeah.
home.
So she's doing us a favor to jump in here for a few minutes. So we just wanted, we have a reader here the mom, I think he must have been a little aware a couple months ago where the mom was sitting 3 days in the emergency room, and this is the lady with the damaged the
The
hand with the
hand.
IV. Yeah, I
Yes,
think
Right.
I remember you
Right,
talked about that.
right.
Yeah, yeah.
Right.
So Judy, how are you related to Farida?
This is Farida. She has her real name.
Yeah.
Oh,
That's
that's
my,
your.
yeah, Farida is
Okay,
my,
okay.
Judy is just my email, my home name, but
Gotcha,
my
gotcha.
email address.
Okay, so it was your mother who was affected by all this
Yes,
mishap.
yes. And
Okay, yeah, I
her foot
remember
was
Gary
a
talking
couple of
about,
weeks ago,
yeah.
and they amputate her leg recently.
And that was from what now? From diabetes complication?
No, the circulation issue.
Oh, she had.
Going to mouth.
Neuropathy or something like that.
Yeah, but they didn't take care of the foot generally in the
No,
first
that's
place.
the issue. We started off with Mount Hope, and so they keep putting us off, going back to clinic, just watching it, and then saying it until we had to take a San Fernando, and they did it in a couple of days' time. We had to call the ambulance because she was in so much pain.
So she had a diabetic foot. Is that what it was? Or that was something completely different?
It's circulation, they said. Blood
Okay, but she was not
circulation. There was
diabetic.
no
She wasn't.
No.
Okay,
She wasn't.
okay.
But they did a procedure, and they didn't take care with the foot when they did the procedure, and that is what lead up to everything else.
Right. They're supposed to well, from talking to Dr. Ramrup, when he saw the thing, he said it has to be amputated, the condition it was in. So
Yeah, but before I'm referring to before
yes.
it reached that condition, it was not properly taken care of in the
Right.
first place, and that's where we end up with where we are.
Like I know the story with the peripheral IV where the IV went interstitial and it damaged the actual tissue and the
Right.
nerve and everything else, right? That, like, I don't know the full story, but I got bits and pieces of it from Gary and from the discussion here a few times, and I'm not sure exactly what the chain of events were, but the fact that an IV went outside the vein and into the tissue, that's something that actually could be prevented every single time, right? Because you're supposed to check on that. The moment you start an IV on anybody, you make sure it's infusing properly in the vein, and you know that because there's no swelling around the insertion site. If there's no swelling, it's actually infusing properly. And that should be checked, in 10 minutes after you start an infusion of any kind, because the moment it gets out of the vein, it's very easy to slip through the vein if it's not secured properly, right? And the moment that punctures the vein and goes out into the tissue, then you have almost immediate tissue damage, depending on what medication is actually flowing through the intravenous, right? And if that's just left, the tissue is just going to decay and break down, like any sort of wound that's not taken care of, especially if it's a very eviscerating drug that's being infused. It can cause tissue necrosis within minutes. Right?
But my concern, Fazia, before we get to that point there, the foot was not properly taken care of. Even when they did a procedure on it, they let the foot
did they do with the foot? What did they do?
I'm trying to get her back to remember, but soon as she could join back, but there was some kind of circulation problem, and they end up doing a procedure. And when they did the procedure, the foot started to decay because they did not
a bypass on the foot, like a FEMPOP bypass or something on the foot.
I think that she said a stent. A stent was put in.
Or they stented it. Okay.
That's what
however they handled the procedure, it was not properly done or taken care of, and they allowed the decay to take place. And flesh is flesh.
So the circulation wasn't restored after the procedure.
So something like that. I'm trying to get it back.
Okay.
Yeah.
Because if I know people who have severe what you call PVD, peripheral vascular disease, there's poor circulation that returns like poor return of blood to the to the heart. And in those people, you have people, they always say they have foot cramps and foot pain and all this kind of stuff.
Neuropathy
Comes with diabetes, prolonged diabetes, and a few other things too, right? And I know in those cases where you have poor circulation, they do like called a femoral or like a fempop bypass with all bypass vessels in the leg, similar how if you do a cardiac bypass, like a heart bypass, similar to that. Or they will stent a vessel that's very stenotic. So if it's actually blocked or it's just stenosis, they will stent it to reestablish flow in that vessel. But if that wasn't done with the procedure and the foot continues to not get a blood supply, of course it would decay, right? It will die. So I don't know if that was the reason what happened, but I mean, I think a lot of care back home Trinidad is just very lax. It's very lackadaisical. Nobody seems to take responsibility. Everyone passes up to somebody else. Like I've had
Yeah.
experience with my mom and dad just recently in the hospital too, right? Nobody seems to own up to their responsibility when a patient is discharged. That there was such poor discharge teaching, or there was no discharge teaching. So a patient doesn't know what to do, wouldn't know what to do, and if someone doesn't speak up, then you wouldn't know what to ask, right? So
Yeah. But unlike here in the US, they give you a discharge booklet.
yes,
These are the things you follow up on after the discharge you.
correct. Yeah.
And you check back with the doctor in a week or two accordingly as the case may be to make sure. Or
Yeah,
they send one of these nurse practitioners home in your home to follow up on you.
yeah.
So
There's very
it's comprehensive.
mhm. No, go ahead. Sorry.
Yeah. The care is very reactionary here.
Yeah.
It's a reactionary rather than
Correct.
precautionary. And this
Correct.
is the problem. Only when something happens to you, then they try to treat that part of it. And so let's say, a toe becomes damaged, they'll wait till it reaches your ankle and then they'll cut it off. And then the next step they'll wait till it reaches your knee and cut it off there.
Yes, that's
No,
exactly,
it's very
that's exactly what I've
reactionary.
come across. Yeah, it's true.
It's
But
reactionary.
they have no problem cutting anybody's feet off,
No.
and
They quick to
sometimes
cut.
they even.
That's a
I mean, they
fast
couldn't
thing.
even do a proper cesarean. We were seeing before, and then we saw so many women die there. Then I mean, somebody had surgery, they butcher you up, and they could give you the wrong medication and cause your body to swell, and it's all well and good because there's nobody to complain and nobody to hold him accountable. But Farida, I want to backtrack a little bit here as I have fast here. We want to get
Yes.
narrowed down to the initial situation, the procedure for the feet that caused the feet to go bad. That procedure that was done, right?
They had
When
they had a stent put in, they said, because of the circulation, and that's the only thing they had to do. They did it without giving her anesthetic. She bawled. She said she bawled.
What?
Yeah, they put it without any. She said because we couldn't go in the hospital and the room.
I can't
When
believe that.
they put it without giving her any anesthetic,
Push
she
it
said.
That alone is just inhumane. You can't cut people open and do that. That's
Well,
madness.
Well, to be honest with you, I think that doctor, he's the one. I don't want to call name. We did a private session with our last resort. We save up our money because we keep spending money, just and to do that procedure is like I can't remember right now. Where we went to the nursing home, and at his office he did it. We went back for the result, and as soon as we went in for the result, and my brother, we wheeled her in. This thing has to be done as soon as possible, and it's 120,000. The guy never asked us if we can afford it, what our situation. Nothing. I watched my brother. I was so shocked, like I couldn't say anything, you know. And lo and behold, he works at Mount Hope.
Okay.
Right? So then when we say, well, doc, we cannot afford it. Remember, I do geriatrics a couple of days a week, private. If the days I don't work, I don't get paid. I'm not a government worker. It's me alone. My brother, he has loan and stuff, and he has 3 kids going to school, young kids. So he never gave us an option. So he said, okay.
Wow.
With an attitude. And I seen all these nice words on his
But the same procedure, he could not do it at Mount Toby. He wants you to come in his place and do it private.
Of
Exactly.
course, he could have
Give us
done a motor, but he chose not to.
he gave us a letter and he like, but this is exactly when I seen all this nice, I said, "He's really a nice doctor." But when he tell us the price and we couldn't do it, he tell his assistant with him, the girl, give them but he attitude with his hand like just fling, give them a letter, let they go mount up. But and he had a tone of voice. But that is a long waiting procedure. I said we understand that.
Wow, wow.
Then
So
we
he was
went.
upset that you guys
Yes.
didn't have.
And next day
Wow,
when my brother took her to the thing, he's the same doctor there, right? They kept her
wow.
till
That is
last
so unprofessional. That would not fly in the States, eh? So, man, that wouldn't fly in the
That's,
States or Canada.
that is
so
what
when
I
this
was just telling
Yeah,
Gary, that the same doctors who attend to you in the
yeah.
hospital has a private practice.
Mm-hmm.
So instead of you waiting a year to get your procedure done in the hospital,
Mm-hmm.
they'll say, okay, come on in my office
Yeah,
and
yeah.
I'll take care of
well
you
here
next
is
week.
part when my brother took her because he took her to the clinic there which was the next day. We um we went the Wednesday to his office. The Thursday was the clinic there in Mount Hope. They kept that my mother there from we reached there. I think my brother reached there from 7 o'clock to 4 o'clock. Then the thing to see her. So then when they reach up now, the nurses and them say, well, you have to come back in June. That was in February, I think,
What?
or maybe before that we did, yeah, come back. So my brother see this the
Oh
same
my.
doctor who did the thing, when we went private. He has this assistant. So my brother went to him and said, well, doc, look at the condition of my mother foot. And they said she had to come back in like a month or something for a blood test. He said, okay, hold on. That boy was so nice. My brother said he went and he get the blood test done the same day. And do you know he called us the Thursday that was done? The Friday I was where was he called on my phone? I was driving. I pull aside. He said if we can bring my mom Monday morning at the hospital to do the procedure. Do you know when we walk into the we wait, all the nurses and them, they show us where we had to go. We sit there waiting. She went in. Do you know it's the same doctor coming to do the procedure?
Oh my God. No, the one who was upset with you guys?
Yes, yes,
Yes.
yes. A lot of
And the
people
guy
feel.
never said good morning to nobody. He with attitude, he going in. I was like, oh my God. He just walk in and walk out. Never say hello or morning to nobody.
Oh
I
my
mean, here
goodness.
we have
Wow.
friends, but
Wow.
and and that my mother said when she came out, she couldn't talk because she said she screamed, she bawled so much because she didn't do any anesthetic for her. They kept her and the
That's
night there.
unbelievable. That
and
is
and,
I
and my
cannot
mother really
believe.
went through some. She don't even want to hear about Mount Hope. A couple times they
Mhm.
called. She said, you know what? She prefer die home. She not going. She not going back there. And we told the people then who called to come do blood test. I say, my mom is not coming back here. Sorry.
Wow.
So all what we
Wow.
all did. But yeah, she said no, it could be different. I said no, she don't want to come. She's like all tense when she
Just,
hear
I
Mount Hope.
remember you had to go all the way to San Fernando to get an angio or something like that, or the angio is in Mount Hope and you had to go San Fernando for the treatment, and it was
Hand,
something
hand,
like
yeah,
that, right?
for the hand.
Yeah, for the hand, yeah. And then they want to send you back to Mount Hope for an angio.
Yeah, they tell me to go back. But when the last time we had to call the ambulance and we got attended to, and that's when they in a couple of days time they had to amputate the leg. They say, well, they don't know how far.
But by that time UNC is in government, so you were kind of a few months in government now. So things
And
was already changing. Yeah.
it was really from Thursday to Saturday morning she had the surgery. And the doctor
Wow.
called us, we went in, we went, we spent the night there. We left like 6:30. We reached home, and like by 10 o'clock they call us and said, well, they want to get okay from us because my mom already gave okay because she knows everything. She know all her medication, everything, and they say, well, we asked how far you all going to cut. They said, well, when they don't know how far they will see, like live tissue, because the leg actually have no life on that by the knee there.
Mhm.
So they cut it a little above the knee.
So this procedure, this doctor did, the stent he put in, it wasn't done properly, or it didn't work, and then her leg continued to get worse. Is that what happened?
Yes, it's continue. He said that will help, and well,
And
when
it
they did it,
didn't.
we didn't do any follow up. They didn't do any follow up except go and they will check the foot, and they're not doing anything. Sending you back, giving you some medication, and that was it.
Did they do any ultrasounds on her leg after the procedure?
No.
Any venous ultrasound to see blood flow and stuff?
Well, I don't know, because when she was in there for the couple days and sitting in the emergency, she said that's the only thing they did with the hand to do the when they put the IV and damage her, and they sent her home the next.
Wow. You see, Gary and Antoine, this is the nasty attitude that some of these physicians have. Not all, some of them, that
Yes.
creates unnecessary burdens and pain and stress on patients who are at their mercy.
Yes.
This is a matter that has to be wiped out completely.
Because we have a culture that nobody can hold them accountable again. Go ahead.
That's right.
They should be held accountable by some board for first of all, unprofessionalism at the highest. Like, you don't go
When-
there with an attitude. People are paying you to do this job with their lives.
When
Like,
I went,
how can you behave that way? Like that, I can't even.
my mom was trembling. She was like, couldn't talk. I cried, and when I called,
That's
God,
abuse. That is
Yeah.
abuse.
All right.
I cried my way
Correct.
from that emergency to my car park. I couldn't even talk to Gary, but I said I had to call to
Like,
let.
that's just traumatizing for anybody. Like, this person should never be allowed to practice if this is what he did and how he treated. Like, this is only one person we know of.
Yeah.
Correct. And sometimes these people think they are God, that they
That is a thing. They're untouchable because
Yeah.
they're untouchable. They make tons of money and they walk on air. They do what they want and they get away with it.
Come to my office to get the procedure done next week, pay me my money and leave.
And that day when I went in, he had a terrible cough, and coughing, and he had no mask. He ain't putting his hand by his mouth. I tell my mom I give her a mask. When I went downstairs, when the guys and I wheeled my mom downstairs, I had cough candy in my car. I tell him, I said, look, take that to the doctor. Yeah, I find it that's so unprofessional. You coughing and you have patients.
No, that is everything about it is very wrong and unprofessional. That should never be allowed to happen. Yeah.
So he said he was sick. I say, you have a terrible cough. He said,
There
yes.
has to be some sort of thing in place for these people to behave. I mean, you shouldn't have to teach that. That's part of human nature,
Exactly,
part of your professional practice.
I mean, I love my
But
job.
the thing is, right? You're right, Suman. They think they're God. People will come to them because people need help. People will go to them no matter what.
They are at their mercy, so they'll spend any last to do anything,
And until these doctors stop double dipping, this attitude wouldn't change because they can get away with anything in Trinidad.
You see, the double dipping is a must because they know the Ministry of Health only has X amount of specialists. So when they employ these other specialists to bring the hospital into so-called international standard, they tell them, look, you just work, 30 hours or 20 hours for the week, but we pay for 40 because they don't have the specialists. So the specialists come make their turns in the wards. By 10 o'clock, they have gone to the private practice now. And Dr. Ram was saying the same thing. My wife does the same thing. She says when the specialists come and he leaves at 10 o'clock, she now has to run the show, even though she's a senior registrar. But she has to run the show as if she is the specialist, which is wrong.
In those days in Mount Hope, long weekends, You can't find
No,
doctors. Always a
you
shortage.
can't.
They say it's
No,
no
can't.
doctors. There's a shortage. Long weekends, like Easter weekend, all those long weekends, you can't get They say to
See,
have
that
doctors.
shouldn't be right. You should have service
Yeah, yeah, yeah.
24/7. That
Exactly.
shouldn't be
Who dead,
holiday
right?
or not.
Yeah.
Exactly. Them on vacation.
Yeah,
You
that,
know.
that that shouldn't be at all.
But I mean, from my
That
knowledge, you're
system that
supposed to have
system has to change. So much has to
everybody
change in the
has.
system.
It have shifts. Everything. It's not that you're working long.
Correct.
Yes, you work long
Yeah.
hours. Have shifts. You change shifts with
Hospitals
doctors.
don't close because there's a holiday.
Yeah, long weekend. You can get doctors.
No,
You can get
no, that
doctors
shouldn't
in.
be.
Well, I ain't going there for a long time, so I don't know.
Hmm.
But
Well, thank God they have a new board appointed in the North Central, which is Mount Hope, really. And I think Dr. Gopi Singh is still trying to
right.
come to
Yeah,
terms and trying to clean things up.
they're shaking up like the thing. They're
Yeah,
making surprise visits and stuff.
yes, yes,
That
yes.
is very good. That should be done long time. Well, now that's a very good idea. Show up at any time, Don't give them no
Yeah,
warning so
so
they could know what nonsense they're doing.
Well, you know, Dr. Gopi Singh is a man you can't play stupid with him.
listen, I
So
work with him and I can tell you, he don't take bullshit from nobody, man. He
Uh-huh.
runs the show on his way, and that is good. But
That's
his
very
kind of experience and, I mean, he was Minister of Education, fortunately or unfortunately. But Dr. Bodo is more on the milder, softer side. Dr. Sichuan is more or less the same way, very mild-mannered and soft-spoken. And I think you need to crack the whip on some of these administrators and senior managers in the system.
You talk right. Yeah, you talk
Yeah.
right.
And I think Dr. Gopi Singh is the guy who will be, if anyone can do it, it will be him.
well, maybe that's why he's in the RHA now. So
He is the guy to make the change.
good.
Well, I hope let's hope that that comes to fruition sometime soon, because people are suffering just from attitudes alone, and from and people and just
Yes.
neglect and lack of simple basic care. Going back to when patients are discharged without any discharge instructions or follow-up appointments or what
You know
to
what to do.
look
What
for,
to do.
right? The thing is, though, that doesn't contribute to what they say holistic care. Like holistic care, you look at the patient, like you treat every part of that patient's being, to optimize the outcome at the end, right? So you come in for poor circulation, you got a stent put in, you get a bypass, and you go home. They should be handed in, instructions, what to look for standard
What to do.
infections,
Right.
what diet to eat, what exercise you should be doing, what to refrain from, follow-up appointments, when to come back to like all these things, right? And they teach the patient and the caregiver. So if somebody is not around, somebody else knows what to do.
Know what's good to right. Exactly.
Right? And that's what's missing, because when my mom and dad got discharged from the hospital recently in Sangre Grande, mom was really sick. She has cancer, like everybody guys know. And she was discharged. She went in with seizures. And my sister picked her up, and she left walking out there with nothing, not even a piece of scribble or paper in her hand. No instructions what to do, no medications explained, nothing. I wasn't there. I came after. Nothing. I'm thinking this is a serious occurrence that happened to her. She almost passed out with these seizures and whatever it was. And nothing about when to come back, like zero education for like how are patients supposed to make it any better or even get better once they get discharged? You're going to come back again with the same thing because nobody knows what to look for and what to do.
Exactly.
This is preventative care. Like you said, it's reactionary, not precautionary, right? You have to teach patients what to look for so they know how to prevent it from happening again, or what to do before it starts getting worse.
Right.
And that's a big part of healthcare that's missing. That's a massive part of healthcare that's missing.
Yes, I agree with you. That is the system. I keep on saying it's a system that
it's a systemic issue. It's a
systemic issue.
Yeah.
And most of these doctors are well trained. I can vouch for that. They're well trained, but over time their attitudes change.
Yes.
But the system, you can get away with so much in the public health sector that, hey,
That's
yeah, that's good.
exactly what it
That's
is.
right. The prescription, get it. But that is only part of the problem. I'll tell you something. In the health centers, what they have is that one doctor is seeing almost 80 to 100 patients for the day.
Wow.
And
That's a lot. Oh my.
no, that's a lot
That's a lot.
in the health centers. And
That's a lot. Yeah.
this is the same thing. So Dr. Bore is trying to, I had a conversation with him last week, Saturday. He was home by us there for a cancer function home by us. And I had a chat with him. And he was saying, Suman, it's terrible. The doctor only has time to say, well, how are you? Everything okay? This thing, write the prescription and say, go ahead. Just take him 2 minutes. That is the key.
Yeah, you can't care for a patient in a few minutes.
Patients, you can't see 100 patients. No way.
Mm-hmm.
And yet we have nearly 400 doctors on the streets who don't have jobs here.
Yeah, that is beyond my comprehension. I don't know how that even happens. Like I
No.
can't. I
Well,
can't
the
fathom that.
PNM created that mess, and now we're trying to
Yes.
fix it.
Yes, correct, Gary. Correct. They prefer to bring in doctors from Cuba and all over the Philippines and what have you. And when our local doctors didn't have employment, and I mean, I'm from South, and I could tell you, parents make sacrifices for the children, pay, rent, their 5 years university rent and fees and upkeep and so on. And coming out with other drug guys selling KFC and all kind of things, selling double-sided Iowa doctors.
Right.
Right?
No, that's crazy. Then I don't even know what to say about that.
It was a victimization process, I will tell you. They made you feel you're second and third class citizens. Basically, that's what they're trying to tell you. Especially if you're ethnically in one of these other ethnicities other than PNM.
Correct. Yeah.
It was such a sad situation. Well, let's hope that the new administration can do something about it. I know Dr.
Yes.
Bono told me he wants to put doctors in primary and secondary schools to try to identify problems of learning disabilities and eyesight problems and so on. And what they found out is that a lot of children now have diabetes.
Childhood, yes, because
Wow.
there's
Diabetes
very
is
true. Yeah.
And ophthalmology issues as well. Sometimes the child is not learning well because they can't see to write on the board and they can't see what's written. And normally your teacher longer time sending the back, which complicates the problem. You're done, still on the back. So that complicates the problem even more. So I know this is one of his plans to get us in going on, so they can identify learning disabilities at an earlier age, and take the corrective action. So
No, I agree with you. That makes sense. Yeah, there's just so much. There's so much to be done in terms of disease prevention and health promotion. Before it becomes an issue.
Yeah,
There's
that
so
is
much to be
really
done.
a public health issue.
Big
That is
public
really
health
public
issue.
health prevention, disease prevention, health promotion, and public health issue.
Yeah, that's
Guys-
a big area that I think we need to improve on in Trinidad. That's lacking big time.
I have
Yes.
to leave you all now because I have to go see about my mom.
Thank
Okay.
you.
Okay,
Thank you.
okay,
We look
yeah.
forward to hearing from you again. Keep us updated.
Yes,
Definitely.
I will.
Hope things
night.
get better for you, my dear.
I hope so.
Yes,
No,
I hope so too, Farida.
okay
You
then.
take care, okay?
No, we have a situation here that
Thank you.
this took place in New Jersey here. And I know Fazia might be kind of tired, so I just want to run this real quick.
No, that's okay.
Yeah, so this is where a tick bit somebody and caused them to be allergic to, I guess, red meat, causing person to die in New Jersey. So they didn't know what was, something is making noise.
Yeah, what is that?
What is that?
somebody sipping something like.
That's what it sounds like.
Somebody.
Oh my.
Okay.
Went away.
Oh no. That is so weird.
Or maybe Judy is still there. I mean,
Maybe her internet something?
yeah, maybe she didn't check her sign out. Right.
So
Yes.
Gary, yeah, Gary, go ahead. So this tick bit this guy, caused him to become allergic to red meat?
Yeah, and he ended up dying. So whatever. So the so
Oh
that
my-
is the nature of the situation here. I think I posted it here.
Wow.
Yeah.
This is the tick, the type of tick that bit him?
Yeah, well, they should just giving you a picture, you know. So so this happened in New Jersey. Looking here, I think I posted it. I'm looking back for the
What kind of a tick is that?
My God. And I
so-
keep on picking out ticks from my dog whenever he runs to the bushes and comes back. Without a tick or two.
Yeah. Wow. That's quite interesting. That's wow.
But you know, they give them an inject. There's a tablet being sold for $400 TT. You give them one of that, and it lasts a year. The dog that is, I could give them to swallow it.
You mean for
For
dogs and
ticks.
cats? Yeah.
for
Yeah.
ticks.
Yeah.
Yeah.
Yeah, it does cost about $500. You're right. My little sister
Yeah.
buys for her kitty cat.
It's
Yeah.
free and tick medication.
Yeah. This is a liquid they put at the back of their neck or head,
Yeah.
and
Yeah.
it lasts for quite some time. Yeah. Mm-hmm.
But this is like a different tick or different insect. It looks more like an insect to me.
Well, it has the shape of a tick too, but it looks. Oh my God, so disgusting.
It
Wow.
has fangs like a scorpion. The
That's
second-
interesting that they actually made that connection with a tick bite and the sudden allergic
meat
reaction to red
allergy.
meat. Like that's so unusual. Wow. Did Gary go?
No, I'm just looking up for the article.
Yeah. So is it just a one person who's affected by this? That they realize this happened?
He died. The person died. Yeah,
That's
New
what
Jersey
I did.
man becomes first to die.
Wow.
He died.
Yeah, he died. Yeah.
No, I didn't understand. He didn't think die from meat allergy caused by
Caused
tick
the tick
bite.
So the tick bit him, and because of the bite by the tick, whatever toxins it may have released, he became suddenly allergic to meat, to red meat, or to meat, I guess.
Yeah, that's what they're saying. So they discovered research saying that they believe they have documented the first known death from alpha-gal syndrome, a red meat allergy caused by tick bites.
Mhm.
Wow. Okay then.
I ain't eating no more good meat again, boy.
I guess don't go in the bushes where you have ticks.
No more
Wow.
So that's one of the latest on the scene, and we just wanted to bring that to the public attention.
That's so
Because
random and so
y-
interesting at the same time.
Yeah. So I'm gonna send the article. I posted it in the group. I'm gonna send it to you, Fazia,
I got
also.
it there.
Okay, yeah.
Alpha-gal syndrome.
Yeah.
I never heard about that syndrome.
Yeah. So
Never
these are the things that we have to watch out for. I mean, there's so many. There's a ever-changing world. With things
yeah.
happening. And that's one of the issues.
Wow.
Right. So, Ken,
Hey, Gary.
yeah, you have anything you want to add to this point? I know we
No,
we dealing with the crime situation there.
yeah.
So we have some progress with the what to say the trade union, the All Field Workers Trade Union, where there was a successful meeting with the Prime Minister and the union, and they seem to have a very successful meeting and moving forward. So these are some of the things that are happening.
Mm.
Let's see. I mean, there's another thing here I had to post up. Let's see if I can find the picture. I had it here. I think this was. Oh no, that's not the one. Yeah, they are. Okay. So, these are the statements from the trade union, in recognition of the worst economic decision ever made 7 years ago with closing on Petrotrin. So now we're moving in the direction of opening back the refinery, and everything is
Wow.
looking pretty much,
But
successful and on its way.
There's some level of
Gary,
optimism
did you read the
moving forward.
entire article by chance? Anybody read the article? What the minister said that in 2018 it was a cabinet decision shared by Dr. Rowley that they made the decision to close down Petrotrin. It was not on was the guy Espinay. He was appointed as the sole person to determine the feasibility of the refinery at that time. But his thing was not to close down, but the whole adjudication to close down Petrotrin was done by the PNF government cabinet. So they
So
were the one who
it wasn't the person assigned.
consultant. The
Who
consultant
you referring to, Malcolm Jones?
No, Espinay.
Spinning. Oh,
Espinay was the guy appointed by the PNM to
right.
determine the feasibility of the refinery
Right.
at that
I
time.
see. Yeah.
Yeah.
But we listen to me. We know why Petrotrin
Yeah.
never made its full extent of performance, because we appointed people according to party affiliation and race and everything. You remember the Petro Singh thing on the Patrick
Mhm.
Manning, right? So
Mhm.
it was not about person competence. They always try to maintain a certain criteria, not so more focusing on delivery. And I mean, it's a wine and jam kind of thing. And everything is go happy and spend all the money, and then I mean, who dead.
The
You
story
think.
there, the wage structure in Petrotrin was fantastic because cleaners were getting more money than doctors.
Wow.
Cleaners in Petrotrin were earning more income than doctors.
First time I'm hearing that. Really? Is that what it was
Yes.
like?
Yes,
Holy smokes! Wow.
yes, at that time. So,
I was just gonna ask you, Gary, what's the latest on the military presence in the
oh,
Well,
there?
they are set to do some training, and the media is spinning things in
Mhm.
all in all
All
contexts
different
that they
directions.
can.
Yeah.
So here, even CNN made some kind of report, say that the president said that at that time he had no intention, and here's a picture of our prime minister supporting Rubio's subordinate secretary of state. But listen, we we're in a good position to secure our country. Prime Minister is making the right decision. The presence of the U.S. military is creating some distress for those who traffic drugs and kidnap people, and organ trafficking and all the kind of
Mm-hmm.
illegal shipment. And who knows what was coming into Trinidad, and who can afford
Yeah.
to bring those things, you know? So the illegal trade, I mean, we've seen how the length of our borders remain unsecured for a very long period of time.
Yeah.
I mean, all the vessels was parked up. So I mean, let's see here. What is this? Okay, okay, yeah. So I mean, I think good things are happening, and with I would like
yeah,
to see. I mean, and Ken even mentioned it too. That we have the U.S. Navy to train,
oh,
and this is something I've been pushing for a long time. That we put a base there, because to tell the truth, I really do not trust Trinidad Coast Guard, the military, and the TDPS to maintain our security to the extent of where there is no corruption. So they has to be under scrutiny. They have to be properly managed. At this stage, we have to upgrade the quality of management. Yeah, because far too long things went the way it did, and you know everybody and their partner and their friends, right? I mean, just imagine the size of Trinidad and Tobago.
That's the thing. Just
A hundred,
imagine
a
how tiny
hundred,
we are.
a
Oh my
hundred,
God.
roughly 100 by 50 miles. That's Trinidad alone, right?
Yeah.
And
Tobago is
billions,
160 square
billions spent on national security year in year out, right?
Nothing is
And
secured.
and
Nothing is secured.
we cannot secure that small island with all
A
that
few
money and
miles.
all the equipment,
Yeah.
right? Just imagine that we couldn't do that.
Yeah.
I mean, and these people had the audacity, you know, to talk, and they're still being blatantly bold-faced and
Yeah.
arrogant.
Yeah.
I mean, you're seeing it, you know.
They're completely shameless. They're shameless.
Yeah, no, Trinidad and Tobago Customs seized over 10 million in narcotics. This is
Wow.
the recent, right?
all of a sudden is making some big fines.
Yes,
And,
yes.
no,
All of a sudden, you're right. Yeah.
all of a sudden
Yeah.
they're starting. And but by the way, Gary, last night a lot of planes flying overhead by my area here in South.
Yeah,
Where?
planes,
South?
drones,
A lot of-
drones, helicopters.
Really?
They have the biggest U.S. warship off the East Coast here.
I saw that on the news.
That's the Gerald Ford.
Yes, yes.
That's a $10 billion warship, which is.
You must be
with all
feeling
the-
nice and protected down there, Suman.
Yeah, but I was watching a show last night right here in my living room, and I hearing all these planes. I peeping out the window to see, and you can't see nothing. Apparently, they were like Black Hawks or something.
No way! Wow.
You couldn't see the planes at all, and
Wow.
they're crisscrossing to and from.
It's a covert
about-
operation, Suman.
From about 7 o'clock to about 11:30
No, wow.
in the night.
Wow.
Yeah. So
Yeah. Cover darkness operation.
yes.
Yeah.
Absolutely, that was it. So it gives you a sense of comfort, at least,
It
and
does to some
a
degree.
sense
Yeah.
of anxiety as well.
I was going to say yes.
Yeah.
Yeah, that's true, because you just don't know what's happening or what is going to
What's
happen,
going-
because
yeah.
they're just saying hush hush about it, right? They let us
Yes.
know what we need to know and nothing else.
But I think they're sending the right message.
I think
Or
so. To
drug
the
dealers.
right to the criminals who are
Yes.
hell
yes.
bent on bleeding this country,
Even
Sends a
though
right message to them, yeah.
even though that seems to be affecting PNM more than anything else.
Anybody else, more than anybody else, actually, you're
More
right.
than anybody else, yes. So
Good.
who knows? They may
Yeah.
have what they say, cocoa in the sun. So what? Let's see.
I am for one, I'm pleased that this situation has come up and these events are happening, like the warship coming, the drones are coming and people are actually seeing things happen, because far too long we've been just a free flow highway for, you name it, trafficking,
Yeah,
drugs,
yeah.
everything, from human
And-
trafficking to everything else, and it's been going on for so long.
So
And just
long.
look at the state of our economy and country and the state of our young people. Nobody wants to work. Everybody wants what you have. They kill you, they take it, they're done, and that's their day work. Like, that should never have come to be that. We're too small of a country. We have too many resources to let this country become the wasteland it has become under PNM.
And just imagine that has been prolonging over
Yes.
all these years.
All these years, all these years, we could have been a metropolis of the Southern Caribbean.
My
My
God,
God. My God. Anyway. Yeah. Where's everybody?
well, I am here. I'm home now. I'm in Trinidad now. So
Okay. Nice, yeah. No, it's just that, and I mean, I'm glad the whatever messages ship is sending and whatever the Prime Minister is doing, to try to lighten the load on the
and
citizens in terms of their safety, in terms of feeling, you know, positive about the future. I think this
yeah.
is the right step she's taking.
And you can see that even in the murder statistics year when you
Yes,
compare it year over year,
correct. Yeah,
month, let's say the same month of October last year versus month of October this year, and you can see like 180 people less has been murdered.
that's
That's a lot.
Same.
significant, man. That's
That's a
Yeah,
significant
yeah.
number.
I
That's
was looking at the
significant.
data last week, and same thing September. They say it's last year versus this year is like pretty close to the same amount, 170 something. There's a 40% reduction in murder.
That's a
40,
that's a
40,
lot to be commended for.
yeah.
Yeah.
And that with a massive, so all of a sudden you've seen all these drugs being,
I know,
sold.
surfacing. Yes.
So
Yeah.
it's a ripple effect happening.
Yeah.
And if that was the primary cause or one of the main causes of these murders, turf and
Yeah.
drugs
No.
and all these things.
So here's a situation where it was seen that the Venezuelan captured these fishermen, and the video was sent to the relatives. You know, so the thing about it is, what is our fishermen getting in themselves involved with that they're being threatened to, and being captured, like this. I mean, this is something, it is not happening. Are they just ordinary fishermen, or what are they involved in? These are the kind of questions we really need to,
Correct.
Yeah. Why would you capture a poor normal fisherman? Like, there's nothing in him for you to like. There's nothing to get from him. So what are they involved in? You're right. Yeah.
So a video showing Aaron fisherman Daniel Abraham being tied and beaten on the ground by Venezuelan men has been sent to his family, intensifying fears for them and two other fishermen who disappeared and were possibly kidnapped for ransom. I mean, what is your dealings? What is your dealings with these people in the first place? So. But let's see how that plays out. The U.S. military is within our waters
Mm.
And active,
and
very active.
fully equipped,
Yeah.
active, and let's see how that plays out. So
Yeah,
Yeah. I'm
definitely.
and pleased that they're there. I mean, it sends a really strong message. So
you were saying something, Ken?
No, definitely, Gary. Look, we need this. Venezuela has been in a state of chaos, right?
hmm
And there's some part of the population there that are living like kings, you
Oh
know,
yeah.
and there are others who are foraging through the garbage just
hmm
to earn a living.
Hmm.
So, so
And
yeah,
they're selling everything they can get,
correct. Um,
including themselves too.
Oh
yeah,
yeah.
and so
That's
they're very desperate. So they will traffic guns, drugs, kidnapping, any kind of thing, and that will also be compounded on our own problems that we have locally with crime and stuff. So we have to control these borders. I
hmm
think the U.S. presence there is a big plus. And Gary, you and I have always supported a permanent presence with the proposal of a U.S. naval base, maybe in Ikaka somewhere there, right? I think that
well.
would be a big plus.
I did a proposal for that, Ken. I don't know if you were in the program at that time.
No,
Where
Ken
we,
wasn't
No,
here at the time. He wasn't
yeah,
there.
I don't think I came across that. But
okay.
what we have
Yeah.
right now is really we're seeing some good results. So, and one thing to deal with these cartels, these drug cartels, I mean, they actually own governments, right? The
That's
hmm
government
correct.
in
So,
Colombia and
yep.
Venezuela and all these other Mexico, they're in the cartel's pocket. And in order to be in government, you have to be in their pockets, right?
Yeah. And
So to go after these powerful drug cartels, I don't think our little island has the
no
capacity
way.
to,
Not
to, to deal
even
with
the
that.
Caribbean.
Well,
Not
no, it's not a matter of going after them. What we failed to do was to secure our borders, and I think we have
Correct.
I think we were fully trained, fully equipped to deal with them as they came into our territory. You know, we seem to be involved in trade with them. You know, our
Correct.
security forces seem to be involved, whether training women, trading guns, trading drugs, trading goods, whatever it is. They were not fully competent in doing their job. You know, because they
Yeah,
seem to be part of the problem. I have some serious concerns about the level of supervision and administration because they failed and allowed or either was part of the transaction taking place. You know,
yeah, definitely, definitely.
I mean, I've heard too many complaints and you know about it. So you know
Yeah,
how people like to come and tell me stuff.
yeah. So
Yeah.
I think a permanent presence
Mm-hmm.
on the island would be a big plus
Yeah.
moving forward, right? I think it will be a big deterrent to these cartels and these drug traffickers, human trafficking,
Oh
guns,
yeah. Oh
etc.
yeah.
You know, because the last 10 years we saw a level of decay and historic crime in numbers. 622 last year, Gary, and 2 years
Mm-hmm.
prior to that, 614, right?
Mm-hmm.
You know, these are astronomical. We haven't seen this type of stats since we gained independence, right? And the island, we were headed downhill. We were just free falling. But with the US presence, I mean, we could look at the numbers, right? It speaks for itself. So I
Yeah.
think a permanent presence in form of a US military base, a naval base, would be a big plus for us, for the US also, because they will continuously need to be fighting these cartels and drugs because that problem is not going to go away anytime soon, you know. That's not a light
Yeah.
switch problem where you flick a switch, right?
Mm.
It's a long-term process and they have to stay at it. And we need the right resources in the US
Correct.
government through the
Correct.
military.
Yeah.
You need military action there, right? Because you have heads of state who are involved.
Yeah.
So I'm definitely for that. I will continue to support that, you know, and Gary's also on board with it because again, we are seeing these results.
Yeah, totally agreed. Totally agreed. I myself would like to see something permanent base set up. And I think it will be in the US interest as well, and because Venezuela has threatened Guyana in the Essequibo region,
Yes,
right? And most of these companies that drill for oil are US based. You know that Exxon Mobil
yes.
and what have you.
ConocoPhillips, all these
Yeah,
explorers.
and a couple from Houston, small service providers and what have you, Schlumberger and Halliburton and whatnot. You have these companies, oil servicing companies, and not to mention the shipping side of it now, the crude, shipping the crude side of it. So
Well,
it will be a good decision to base something in SCP and Cedros to monitor both Trinidad and
yeah, yeah,
Guyana. The interest to protect American self-interest,
yeah. Because
and
you know Maduro,
we will benefit from that as well.
correct, correct.
You know,
And you know Maduro and his defense minister, they implied that Trinidad was once a part of
oh
Venezuela,
yeah, but
right?
the same thing they're
So,
saying with
so
Guyana.
what they're thinking about Guyana annexing a part of Guyana, they're thinking about taking over
Yeah,
Trinidad also. You know,
but that's the SCP region.
yeah. So
Yeah, that's
a
the
military
Look at the
presence.
screen. Look at the screen.
Yeah, Maduro, Venezuela were not threatened by TT US military drills. You know, that is all talk, Gary. He has to look tough, eh? You know, but
yeah.
And we got some of these flying around. So
yeah,
Sumati might
yeah,
be hearing, might be
You
hearing.
can't, but Gary, you can't see them.
You
You
can't see
cannot see
them.
yeah,
them. So at least the presence is comforting.
yeah,
That's a
yeah.
that's a very powerful helicopter there.
Yeah, yeah, and that's what's the Southern Spine. That's the name given to this operation. The Southern Spine.
Southern Spear. Fine
Southern
spear.
Spear,
spine.
sorry. Yeah,
Spear.
spear. Sorry,
Yeah.
Okay.
Southern Spear.
So Fazia, I don't know if you saw this. I sent you this.
Yes. Yeah, I actually
Oh,
called
yeah.
my little sister, ask her what is this about,
They're
and
they're
she said,
terrorizing some family there.
yeah, and she said this is somewhere a place called Charuma, which is just after Beach. So if you're coming from Sandy Grande side, you go through Komuto, Guayco, this place, and you come up to, to Plumita and then to Beach, and after Beach is Charuma and Navet, and then it's Rio Claro. So Charuma is
Mm.
about maybe 10-15 minutes drive from Beach, and you go, it's a place, it's that little village there that there were a few people who were being terrorized by, I don't know if they were bandits or people who um, were involved in drug money or something, but they said it was people. That's what she said it was. They think it was about, but it was not a recall in instrument. Something about drug money or
Yeah,
something like that.
yeah.
She said, yeah, that's
You
what
know,
she said.
it's a typical when you break it down, right? It comes down to non-productive members of society, right? Threatening and creating chaos, and they're trying to infringe on the productive members of society who are working hard, paying
Mm,
taxes, and making an honest living, right? And these are the pests walking around the place,
yes,
invading their homes,
yeah.
right? And that is a very, very serious topic, and we've been discussing this, and we are monitoring this carefully. Gary, you could expand on that also. Hello,
Like no, she
Gary?
said that they were trying to bully citizens
Well,
into
Well,
doing things.
the businessmen,
Yeah,
they
yeah,
want to tax them, right? They're
yeah,
going around
yeah.
saying,
About,
hey,
do we have even police involved in that too, bro?
yes, caution
exactly,
money,
This
exactly,
is craziness.
exactly.
You know what? That has to end. You can't have that. You know?
protection money. Every
Yeah,
Friday.
Wasn't
Yeah.
and if they don't pay, they was going to get the criminals
Yes. To
to
even
do,
yeah to make them pay now.
yes,
and
yeah, and
also
we have situation. We have not cleaned up the country. We have a new commissioner of police, but he has a lot of work to do yet. So like I keep reiterating, we did not change government to maintain the status quo. So we're not out for any mama guy. We want some real action. The U.S. will be there in their face. And that is what I love. Whatever agreement the prime minister made, the U.S. is going to be there's going to be a heavy presence of U.S. forces within Trinidad borders. There'll be some training, and things are going to be looked on.
Oh, I'd like to see them in our city streets, Gary. That would be just ideal. I would love to see them on our city streets.
Well,
Maybe
they won't go that far.
I know they won't. I know, but I'm saying I would love to
Because
see them there.
they will
Yeah,
do all the
they would
training
need
and
it. I know.
assisting
yeah,
with
I
us.
know.
But we have a long way. We have a big transition to really to do in order to get things where it needs to be,
Yeah,
and
yeah.
we need UNC to keep the government in order to really get this to the point that where we are really secure that the country is prosperous. And some people are so bent on making any kind of trouble they can to cause people to disbelieve in the
Mm-hmm.
government,
Yeah.
and lose trust and lose patience. But
Correct.
I know the prime minister has the best intentions for everybody, and she's moving forward. And I want to encourage her, and give her all the support that we can from our end. Look, we have
definitely.
a gentleman here that escaped from the prison, Ken, and you saw the article.
Gary has sent you some pictures where this guy broke through a wall in the prison, right? And it's more justification. I mean, we were looking at clay blocks here. This thing was made out of clay blocks about 100 years plus years ago. And that's more justification to decommission this structure. I mean, the life cycle, this has exceeded the life cycle, right? This is going on over time and borrowed time. So the prime minister, in the proposal there, they want to convert this thing into a arts center, right? Somebody correct me if I'm wrong.
yeah.
And I think that's the best use for it. We do a structural evaluation, ensure that it's structurally sound, seismic, etc. And put it it's in the middle of the city. Give it a nice flair. Subad, you mentioned some kind of
A
a
Carnival
carnival
City,
display
yeah.
and all sorts of stuff.
Yeah.
Yeah.
For the
You want to
cruise
elaborate on that?
liners coming down. The cruise liners coming down and Port of
Yeah.
Spain, they have
But first,
about six
yeah,
hours to kill.
definitely. Yeah. And they go right there and
Actually
enjoy
use the
the
word
the, the
kill, but they have hours of spare time for them to visit, the
yeah, yeah.
sites and so on. So I think they can make it into a carnival city and all this.
I'm not sure if Fazia, did you see the video?
I did actually. I saw the first half and then I saw the second half a different day, and I was just completely blown away. Like the plans and the foresight is just it blew my mind. Like
Yes,
it
everybody.
seemed, yeah, it just seemed it
Very,
wowed me. Yeah,
very
it
impressive.
wowed me. Yeah.
And I just really hope that they can achieve even half of it would be nice for me.
That would
Or-
transform our little island to a first world nation. I'm telling you.
Correct.
Yeah,
And
we,
now
we
Yeah.
need we need to make that Gulf a hub. Ken is working on a project for us that where we're going to create a causeway and things like that, to kind of make things more accessible.
Yeah.
But we
Yeah,
talk about park and
we need
ride
roadways.
and
We have so many
quite a
cars.
bit
We
of
need more
things.
Yeah.
roadways. Yeah.
And you know, Gary, as Fazia was mentioning some of those little towns there, what's Plumita or something?
Flamita and Beach and
Plumita, Beach, all these things.
Navet
Um,
Coach.
they,
Yeah.
they ring a bell because we're proposing a road connecting Central all the way to Manzanilla there, right? And
Okay.
passing it through some of these small towns, just on the outskirts of some of these towns, right? So that these people now could have accessibility because it seems very remote in those parts of the island. Yeah.
Right
And
now, Ken, that road is one lane, a single car lane road
yeah,
that connects Beach from Beach to Sandy Grande, and there's another road
yeah,
that goes through Manzanilla that goes through Manzanilla, Plumita, and connecting to Beach. Now that road is a snake-like road. It's so curvy, right? I think it's almost like a 15-mile length stretch of road that takes you
yeah.
about 45 minutes to
So,
get through.
so,
It
so
should take
question.
you
So,
15 minutes.
yeah. So, question. It seems like you're from the area. You're familiar with the area, then?
I'm from Beach.
Okay.
Yes.
So let me
I'm
ask the
from
question.
Beach. I know,
If we
yeah.
were to build a highway, a road, a two-lane, right, a dual lane each way,
Mhm.
from Central or from Todd's Road, coming straight through all of those, connecting touching all of the little towns and going to Manzanilla, and then connecting to the major proposed highway from Sandy Grande all the way to Mayaro and coming around.
Where
So,
would that road? Okay, so we'll start from Central
well, we're
going.
looking at Todd.
Mhm.
I'm looking at Todd's Road, right?
Where is Todd's
And
Road?
then that is like Londonville, somewhere in that area,
Okay.
right? And then you can now connect to down in Felicity there, a causeway, and go straight to Port of Spain and to Chagaramas.
Right.
So how do you think that will impact your community or your area down there in
And
that
hold it
central
there,
part of the island?
as well, because there's another one from San Fernando to Mayaro, a highway
Yes.
from San
Yeah.
Fernando to Mayaro. So on either side of Faza, there are highways running.
That's good for us if you have to get to those places, but we're like in the center of, like, we're kind of in between. We're center of Rio Claro and Sandy
Correct,
Grande.
yeah.
We're stuck in the
Yeah.
middle. It's all
And it takes you a
bush,
long commute
right?
time in case of
Yeah.
So it's
emergency.
a long commute.
Emergency, yeah.
Yeah. But the thing
So-
is, if it was a straight road, we'll get out of Beach in 10, 15 minutes, but it's not.
Correct,
It takes
correct.
a good 45 because the roads are so bad.
Yeah.
Plus, it's a single lane for most of the road. You have to like stop on the side to almost fall to a precipice for another car to pass, right? All these big trucks, tanker trucks, like everything passes on this little road, and it's never a smooth road. It's always broken,
Yeah.
always landslides. There's potholes. You can actually put ducks in there and live.
Oh.
They live like it's such a bad road, and it always keeps being patched up. You know, the rain season comes, it gets washed away. That road needs to be fixed. Like I said, it's one to Plumita, one to Beach, and I think
Yeah.
most people have left the Beach road because it's so bad now. They're using the Plumita road, which has gotten so worse. And when I was in Trinidad last month, my sister took me to the Beach road. I was shocked. You know, when you don't drive on the road, you have grass starting to grow on the pitch.
Wow.
Oh my
Grass
God.
was growing on the road
Yeah.
in Beach
Yeah.
now, in the Beach road.
So
It's
so
more
I
than
think
different,
a roadway
A
in the
roadway
middle
will
of
be
the island,
life-changing
east-west, in
for
the
the
middle of the
villagers.
island, east-west,
Yeah,
connecting.
we're gonna send you some of the design, but Ken, go ahead and explain to her.
Yeah.
It gotta be like a causeway, kind of.
So it will create accessibility. All these little towns there, right, will benefit even from an emergency perspective. If you need medical attention, you need to get out of hospital. Yes, there's Sandy Grande there, but now you could also jump in a car or get an ambulance and come straight to Central or Kudikova Hospital. right? In a
You
matter of
see,
minutes.
that would be life changing for the people who live there. Life changing.
Definitely, definitely. And Gary, I mentioned also, right, that part of the island is undeveloped, is untouched. And
Oh
because of
yeah, I
the
mean
lack of,
you go down there, the place is not really. I mean the place is like when I left it 50 years ago. You
correct.
know.
Mind you, it's good there because there's such good wildlife. Like
Yes. Yeah.
you see the whiteback macaques and monkeys. Like you hear them like they're on the road. You see the wildlife is so abundant because it's so untouched. But
So
at the
so
Correct.
wha-
same
so what so
time,
what
the
I'm
road.
suggesting and what I have Ken working on Fazia
Mhm.
is that we want to lift the road where it's a little bit elevated so when it floods the road is not damaged, plus to
Mhm.
access the people that is in distress there will be nothing stopping it because if we build
Right.
this road right into a causeway or semi lifted,
Right. Right. Yeah.
some place you will have to go a little higher than the other, but at least the water will not cause any obstruction or water damage, and you don't have to keep repairing it. Now, if you just go and patch the road and grade, and every time it flood, you're going to have to keep doing the same thing. It's better we spend the money to do it right.
Mhm.
Yeah,
And you build the road lifted, and then you could create some boardwalks and
yeah,
stuff by the ocean off the causeway. That way, you have it's a multi-purpose thing, and it will work.
The
yeah.
thing is, yeah,
And
that's actually very important because that whole area is very flood prone.
That
It's low
Manzanilla
lying.
stretch,
It's
that
low
Manzanilla
lying
stretch all the
and
way to Caliota.
yeah,
That road that we need
yeah.
proper road going that way. Too many
But
times
that
that road
yeah.
what was it called, the Ottawa River? That was the one, Ken. That's the one down in my road, Ottawa River.
The one
Ottawa,
way opens out and next to
Or,
the ocean.
The black one, the Black River. I know that's the Black River.
I don't know what it's called in the
I
mid
think
on
it's
the
called the
mountain.
Ottawa River, if I don't
I
make a
think you
mistake.
might be
But
right. I think you might be
Yeah.
right.
could be right.
I think you
Yeah.
might be
But I know
but
the
that
swamp.
yeah,
Mm.
the
Well,
swamp
I
in
learned
Beach
about
and
that. I
Flamita is
learned that
very
place
flood
in the
prone.
'70s when my
Yeah.
father was working to build that Galiota platform out there in the '70s.
Mm-hmm.
So we used to be living in two places. We had to stay partially in my arrow there. And then sometimes because my dad was working out there, and
Mm-hmm.
but yeah, I learned about the that river, and in fact, I was saying the other night. There was flood and that, and the bridge was washed away. And my dad was coming, bringing us back because I had to go to school back into Central, and the road was washed out. And a guy
Yeah.
flagged my dad down to stop him because we didn't know the road washed out. Otherwise, we'd have been in that.
Flooded.
We
Yeah, that
was
area is
gone.
very low lying, especially in the swamp
Yeah,
because they used to plant a
yeah.
lot of rice and beach and plumita there, so it's very low lying area. So whenever rain
Mm,
falls, a lot of the beach road is
yeah.
flooded. We have lots of trees and like 100-year-old trees falling over and blocking the road. So when you get to the road there, you're
Well,
stuck because you can't
there's a
cross.
lack of, I see, a
People
lack
have
of
to do that.
maintenance, lack of proper
Yeah,
road. All these things
yeah.
starts to be moved away. Even when in the US, if I see a tree that's hanging over the wires, I take a picture and I send it to the town. You know.
See, yeah, now people in beach, everyone travels with a cutlass in their trunk because they're expecting it. No, they do because they're expecting a tree to fall. And when the
Mm.
tree falls, they chop it and they move it because they'll be stuck. That's what they do now. Everybody has a
Yeah.
cutlass in their car for that reason, especially in the rainy season. Because guarantee at least one tree would fall every day in that
You,
forest
you need more
across
than a
the road.
cutlass. You might need an axe
Well,
or a
people
power
carry it
saw.
because that's what they do because nobody
The-
comes and clears the road there, right?
I
They
was
stop.
thinking. I
Yeah,
was
Well,
thinking.
that's going to change. I
That's what
mean,
they do. Yeah.
yeah.
that's
But
going to
the thing is,
change.
so Gary, that Beach Road and Plumita Road, I mean, that has access. I mean, there's little villages along those roads in Plumita. So even if you do have a causeway that connects the little villages directly to Central or to North or South, people still need to get out of that area to get to Sandy Grande or to Rio Cloud. So those roads also need to be addressed because from the time I
Yes,
was
correct.
born,
Correct.
1 day old, that road has been as it is today.
Yeah,
Bad
well,
as well.
hopefully, yeah,
Wait,
Terrible.
wait
hopefully
till you see
it
the
should
design that
connect.
Ken is coming with.
Yeah.
You're gonna love it.
Mhm.
Now there's
Yeah,
a
but
proposal to do to extend the road from Sandy Grande to Manzanilla, right?
Okay.
So that will just connect it and make a T, you know. Um,
Okay.
and what we are looking at a concept of a beltway around these big major towns like Sandy Grande and Central and stuff, right? So we
Mhm.
don't have all the traffic conversion trying to maneuver through the town to get to one area, one part,
Right.
right?
Yeah.
Similar to what we have in the States here. You would have a 95, then you have a 295 going around our town,
Right. See,
So
right now, Sandy Grande is extremely congested. Like to
beyond
get through
congested.
Sandy Grande on rush hour time, you have to give 2 hours to actually get through Sandy Grande to get to
Yeah.
Valencia. Like it's ridiculous. It never used to be that way. It's
So
so
a
congested.
beltway connecting a major trunk, right?
Yeah.
Going up there would definitely cut down on commute
That would
time
alleviate.
and
That
traffic
would
congestion.
alleviate. Yeah, and that would
Yeah,
just
yeah.
that would be life changing for the villagers who live in those small little pocketed villages.
Definitely. I mean, it would add value to the property, would brighten up the
Yeah,
property.
yeah,
And
absolutely.
you would
You're
see more
right. Yeah.
commerce, more commercial activity, more employment,
Yeah,
and stuff like
absolutely.
that. And that is the hopes and that is the intention, right?
Yeah.
Because in order to create and to expand and to grow these little communities, you have to make it accessible.
You have to make it accessible. Yeah, you do. You're right.
Yeah, yeah. So those are plans in the works there.
Well,
And
I'm very
Gary and all
happy
of
to hear
us are involved with it, and we'll roll out something very soon.
Mm-hmm. That's amazing. Yeah, I'm so happy. I feel so happy for the future of our little country now. And I was just so sad and depressed and like this is like it almost like you lost your country the last 8 years. Like you felt like it was taken away from you. Like it's no longer the sweet TNT we used to know.
Well, I mean,
I feel so much more
it wasn't a free
positive
fall.
about it.
We,
The
we
country
still
was in a
got
free
we still
fall.
got a lot. We got a lot to fix because the country has been infested so much
No, I know.
with
Yeah.
dangerous people and criminal activities that we're not safe yet.
Guys,
neglected also.
we need UNC in government for at least another 20 years to see this through.
That's correct. That is,
Honestly,
Yeah,
that is
yeah.
to see
key.
this through a 20 years span.
Because I don't know
Definitely.
how much they can do in this 5-year period.
They will just begin to do stuff because the moment
Correct.
somebody comes in, they're gonna just erase everything we're doing. Everything.
Correct.
Yeah.
Absolutely. I made that same point,
Yeah, we need 20 years of UNC.
that we can
Yeah.
end up with some white elephants along
Yeah.
the way.
Yeah.
Once another party comes in and say, hey,
They would just
got
negate
that
everything.
plan.
Yeah.
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 So one of the first things you have got to do is to make sure that this is a development plan for Trinidad and Tobago. And
Mhm.
whichever government is in,
Yes,
with-
correct.
let them continue it on. And
You
you
have
see,
to see it
you
through.
have
They,
to
they,
pass
they
legislation.
will still they
Correct,
would
you're
not
right,
be able to
Simon.
do it the way we will do it. So no other
Correct.
government cannot come. We have to make sure we have to get vicious now. We have to make sure no other government come because no other government will do it the way that we will do
No,
it.
they won't. They
Right.
will
With
always
the level
find
of
fault.
quality.
Yeah.
With the level of
Well,
quality.
Yeah.
Right?
Friends and
You don't want to
family
build stuff
getting
because
contracts, man.
ever so often people build stuff in Trinidad and you have to go back and remediate it.
Oh
Right.
my God, you're so
And-
right.
and-
You
and
build
the
it
PNM
through
For
has-
example, that's
passion.
Sandy Grande Highway there, right?
Yeah,
That's Sandy Grande.
that is a next case we're working on, right? A political project, we want to call it a political project. They try to deliver this, rush it down, right, halfway, to get some political mileage.
You mean that
But
highway
this
they built to Sandy Grande?
Yeah, yes. So
I passed on it twice.
yeah,
when I
what
was
is your
back
opinion on it? What do you think about it?
I like the highway. Mind you, the road is not, it's so rough and bumpy for a brand new highway. It's so rough and bumpy. It's not smooth at all.
Yeah, what
At
about
nighttime-
coming around those curves?
At nighttime, I find the street lights that they put, I think they were too tall because it doesn't reflect on the street. Like you don't see the lights lighting the streets. It's very dark. It's the street lights are too tall. Like if you look at it, it's taller than a normal street light. So it doesn't provide any lighting in the nighttime.
Mm.
And then for a brand new highway, the road is very rough. The car shakes like this. It's very rough. It's not smooth. Like so, there's very poor engineering on that road when they built it. Looks like
For construction.
poor construction, yeah. And
Yeah,
they
yeah.
cut down so many acres of land on either side, and yet the road is a small. I mean, it's a decent sized road, but there's so much extra land on each side. I'm not sure what that was meant to do.
Well, when
But
they
so
removed the
much extra.
vegetation, and you made a good point there, they removed the vegetation and they left the bare soil. right? And they
Yeah,
sloped
that's
it.
going to erode. At least they should at least plant a
And
full set of trees long
yeah,
term to line it at least.
well, they should
Mhm.
have benched it properly and plant
Yes.
some vegetation to
Yeah,
prevent
put back
erosion.
some more supporting natural structures
Because
there so it doesn't erode.
tons of silt and sand is getting
Yes,
washed into the drain, and that's going to
correct.
create a problem also.
That's going to
So
create more
yeah, so
flooding again.
flooding is going to trap a lot of
Mhm.
garbage. We'll see like a
Yeah,
lot of vegetation growing in invert, and then what happened? That water is flowing through San Grande also, right? And that's creating a
see?
problem with the
Yeah,
flooding there. It is exacerbating the flooding,
yeah,
you know,
see, there you
and we
go.
have to investigate that. We've discussed that, a little while ago. Um, but we are going to get to that at some point.
Mm-hmm, mm-hmm.
So yeah,
I
so
mean,
a
it
lot
was
of
a good
work.
idea, but the construction was
It has
not.
to
And
be
how
built
the road
properly.
is
It wasn't
It
narrow
has
well
to be built
and
properly.
executed.
Yeah.
too
Yeah,
many
it
cars have
wasn't.
run into that guardrail. We having too many issues with cars running into that
Yeah,
guardrail.
it wasn't well executed at all.
Yeah.
Yeah,
So when you build something, it should be built with quality and should with the intention to last and should function and serve the purpose, right?
it should be very
You know.
user friendly where it does serve a purpose because actually in the
Mm.
nighttime those street lights provide no light. It is so high up. It's almost like a
Yeah.
twice the height of a normal street light, which I've never seen something so tall before.
Yeah. And
It's
Gary,
very weird.
yeah, and Gary, we don't want to be building stuff like that. Los Alturas towers there where they had to had to demolish, and it cost the taxpayers millions of dollars, right? That is where we don't want to end up. So we are going to learn from that and do it better
Yeah,
than that.
correct. Yeah, yeah.
So yeah.
We
So
people
very
have to
exciting times
see.
ahead.
Yeah, the citizens have to see that UNC is the best bet that they have in terms of creating a country once used to have many years ago and make it a prosperous country again.
And that
People
comes
have to see
with a
that.
vision.
Yes,
Definitely. And
that
that
comes.
comes with a
Yes,
vision.
yeah.
And I think what you're saying is reflected in that ambitious plan that was
Mhm,
just rolled out,
mhm,
that
mhm.
developmental plan. And again, there'll be short-term and long-term projects there, and
Correct.
we
Yeah,
always
yeah,
discussing
correct.
these things, but there are some problems that we have to deal with first in order to complement all of this. And that is the traffic
Mhm.
congestion and the flooding and the crime also, because you
Yeah.
don't want to be bringing tourists into Trinidad and they're getting robbed right in Port of Spain there,
It's
right?
happening
These,
it's happening all the
yeah,
time, and that's
exactly.
terrible. That's such a bad taste. Like
Well,
I would never want to go there anymore.
we unless we fix the management of our security force, we spinning top in mud. All right, and we would always get misled, and we always get set up because unless we fix the supervision of the security forces, especially the police now, I
Yeah.
mean, it's not going to work, because these guys are determined to do what they want to do. They want an easy living. They don't want to
Mhm.
work. And, I mean, some people want to work, but some people don't want to work. Some people got used to come in and take in. If I could come and take what you have in 5 to 10 minutes,
Yeah.
why not, right? So
Mhm.
that's how they operate, and those of us who worked very hard and built what we had over the years, it's like we did something wrong to some people, and them have the right to come and take it because we took away from them by working hard. So some people have that kind of mentality, and so it's a mindset. You're fighting a mindset because their
Mhm.
mind is made up and they're taught in that way that you did something wrong to them by your hard work, and their
Mhm.
intention. So, I say we got to respond with something, forceful like this here, you know,
Definitely,
um,
definitely.
you know, um,
Yeah, yeah.
we might have to have our own Batimanzel. The drones that you have
Yeah.
a drone that has ammunition on it
Yeah.
that could
Yeah.
fire some small bullets.
Yeah. You see it in yeah. You
Yeah,
saw it in
yeah.
We would get to get our personal drones,
Mhm.
because that is what I call the Batimanzel. You know, so I mean, the government is working on putting some legislation in place, and we know that is coming. So, but legislation alone does not, stop the criminal. There's a lot of things that has to be put in
No.
place,
Yeah. You have to have
and
the manpower to be
training.
behind them,
Yeah.
and make them pay for their actions. This is the
Right.
thing.
Yeah.
So, but you see, the
Yeah.
thing
Right?
about it, I have a philosophy, and I've said it many times. justice don't resurrect the dead. In my philosophy is to stop the enemy in the tracks as they come.
Mm-hmm.
So you
Yeah,
have to be
yeah.
organized
Yeah.
to respond. You have to be organized, trained, and equipped to respond to the threat.
You
Yeah.
Stop
know,
the
and
threat,
yeah.
like hit the threat like I hit us. You're hitting a six. That's what you're
Hmm.
supposed to
Yeah.
do,
Yeah.
right? Until we start doing things like that, we won't see no change.
You
Yeah.
know, Gary,
Exactly.
when you mention, we have to like change the mindset of the management of of like from the top down, right? Because you know how they say bullshit rolls downhill, not uphill, right? So if your management on top is poor, like the PNM, the entire system becomes rotten, correct? Because that's their platform. It's almost like,
Yeah.
when we, back in the days when we were younger, and you import stuff from England and Canada or US, that was the good stuff. It was high quality, it was well done, people, and you paid more for it, right? And and when we
Hmm.
consult with different foreign teams to build a highway, build buildings, they tend to be of a higher standard quality. You pay more for it because it's built by foreigners. That mindset we have, right? And some of it tends to be true. So almost like we have to, bring in consultant teams from different parts of the world who are trained, who are used to different standards of functioning, to train our people home in
Quite
Trinidad,
true. Quite true.
to have that level of care so they can carry on when these people leave. Like, you know what I mean? Like, we have all lived and worked abroad. We know the
Hmm.
standards in our different
Hmm.
fields, respective fields, right?
Yeah.
We
Hmm.
can't have people home who have not been exposed to what we have been exposed to and expect them to know what we need to do. Like, you know what I mean?
Correct.
We have
Yeah,
to
yeah,
have
yeah.
our
Definitely.
mindsets
Yeah.
in groups to train these people in their respective fields to get them to the level where we want to get the country to,
Yeah.
because doing the same thing over again wouldn't make things different. That's my just insanity. That's madness, right? We have to do something different to get a different result.
Yeah.
And that
Definitely. Yeah. You
that
couldn't have
is
said
the
it better.
problem. That is the problem.
Yeah.
Mm-hmm.
And one wonders who is going to do that or change that, because these people have so been ingrown in doing things
Yes,
their way
correct,
that
correct.
nobody is going to change them, especially
And that
public
I
servants.
experienced that firsthand when I was at West Shore for the 1 year as director of nursing. I experienced that, and that's why I can speak up, because I know what I went through with them. Yeah, yeah.
And secondly, Fazil, if I may add something to what you're saying, the world is changing so fast with technology and AI and so on. And if we are basically, a lot of these workers here are not capable of using these systems to
Mm-hmm.
increase efficiency and productivity and so on. They prefer to do things the same way. Like, for example,
Yes,
most
yes.
offices you go to still close for 12 to 1 for lunch.
Yeah, it's true.
12 to
Yeah,
1 for lunch.
yeah, you're right. Yeah.
Licensing office, you go to
Oh my
county,
God. Yeah.
the head office, they say, no, we can't access the point Fortin access. Then you have to go to point
No,
Fortin.
that has to be done away
All
with.
of
That has to
these
be done away
things.
with. If you're on lunch, somebody else is replacing you so we can keep efficiency at
Man,
a certain level.
I went to San Juan to get a board of Inland Revenue number, and they said, no, you have to go to Port of Spain. Bullshit. Sorry, but
Yeah.
I
That's
am
the
Yeah.
so
Yeah.
second
upset.
capital of the country. We
And
should have,
and it took a guy less than a minute to get it
yeah.
done.
See? Yeah, there you go. Yeah. That's the thing, right?
So if we're not working smarter, yeah, no, if we're
um,
not working smarter or using the, you know,
the tools that we have at
adequate
our
technology,
disposal, we're just going to be one step backwards than everybody else.
Yeah. Yeah.
that's right.
Definitely. Yeah.
That is
So
my
we need.
concern.
There's a lot of room for improvement.
Oh,
A
absolutely,
lot, a
absolutely.
lot,
You
a
know,
lot of room,
Yeah.
a
and
lot of
I know
room.
it's going to be take it step by step, day at a time. But I believe that if we don't have a certain type of personnel to train or manage
Hmm.
to bring about change that we want, then nothing will change.
Yes. No, not
Yeah.
that's right.
Definitely.
And
Definitely.
people have to want to change themselves. They have
Right.
to
Yeah.
don't
Yeah.
feel threatened by it, or don't feel somebody's going after your job or something.
You know what? And
That's
you're
a
right.
change
You're
But
absolutely right. Man. If
if
you're
you are
threatened
not
by change.
properly educated on what the change is,
Yeah.
you will create havoc. So education and information has to play a role.
Yeah.
yeah,
Yeah.
yeah, but
Absolutely.
Yeah. Yeah.
But like I said, when you're accustomed to doing things a certain way for the last 20, 30 years of your life, and if the country's
yeah,
culture is such that it doesn't allow you to be open to change from a foreigner or from a foreign team or whatever it might be, then you'll be so hesitant to support that, even though it's for the better of the country.
Yeah,
You
you
know,
need that foreign experience and set of eyes to come in and guide
yeah, I mean, if you need
guide the
that, I
process.
believe that because we are more advanced. I mean, I'm not putting Trinidad down, but that's just how it is. We are more advanced in the first world countries. We have access to all the different specialties and advancements and whatnot. We have to bring that to our small rural country to to increase our level, in the international standards.
you're right. So you
Correct.
We
see,
need to bring
when you
that.
come with that mandate back home, like say I left Miami now 35 years, okay, back to
Mhm.
the States back home, and I'm in transition. I don't know where to start.
True, true.
How do you know where to start?
Right, you're
Who can you
true.
talk to? You have seen
Yeah,
both sides of the coin.
yeah, yeah.
Expose yourself internationally,
Mm-hmm.
as well as the local system. And in my case,
Mhm.
I've been through this local
Yeah,
system.
yeah.
So you know exactly how it is. And one wonders, how do you change a system where people have been embedded in doing things a
Yeah.
particular way? It's just
That's
like
that would
difficult. I don't know how
yeah,
you
yeah.
to start, you
That's
know?
a monumental task.
Yes. And I've been speaking with people, senior people and so on here,
Yeah.
and they say they are so inundated with work and so on. And I say, like, tell me an example what you had to do. And so I want to hear what they have to do is repetitious, submit paperwork, project, status of their projects and so on.
Mm.
You see, man, that does take more than half an hour to do. I say, really? I said, yes. If you are project manager, you have project management software to
Yes,
tell you
correct.
everything about their project and monitor
Correct.
and evaluate your project. Get your gap analysis done and why wasn't it done, how many man hours it costing. There are
Mm-hmm.
software for you to do that, man. Boy, no. One man does it, the other guy is doing it manually. So what happens is that you're creating an imbalance all the time. One guy knows what he's doing and he finishes his work in half an hour. The other guy taking 2 weeks. So
Mm-hmm.
how can you coordinate things?
Yeah, you're right. You're right. Yeah.
Can you coordinate things? It's like someone doing an operation with needle and thread and you using a laser or something. How can you coordinate that?
Yeah,
You
no, you're
can't.
right. You're right. Yeah.
So
So
this
this
is
is so
how
this is where your specialties and your professionals and people who are versed in these different aspects of what is we're doing comes in, right? And your field
this is it.
assessment, comes in the boots on the ground. These people come in to do assessment from the top, from the bottom up, right? I
Yes,
mean, that is
yes.
the most difficult thing to do is
How
to
can you do?
elicit,
I
bring
mean,
about change in a system
yes,
where it is resistant to change.
from 1986 to today, I've been always on the cutting edge of technology, and I find myself here doing what? What am I doing here in the world? I'm retired, man. Let me just retire and go to the beach and so
Oh
on. I
God,
just
I don't think you're retired soon, man.
think so.
I don't think so. No.
We cannot
I will.
mentally and psychologically retire, knowing the condition and state of Trinidad and Tobago and the way it is, and to know that some
Yeah,
of
I
us
would
would,
like to
most
leave.
of us would like to go back there, and we want things
Yes, you're right. I would
in
love
a
to go
Yeah.
back there.
structured in a certain way that you could get proper response with medical care, and you
Hmm.
go to conduct some kind of business, things are working effectively, and nobody's trying to put spokes in your wheels. You need professional, effective response when you try to resolve a matter. You go to the police, you want effective response.
Correct.
So
That's
quite
the
a bit of
thing.
things. There's
Definitely.
a lot of things that we have to fix and upgrade.
Yeah, you want to be
Yeah.
able to
Definitely.
trust the police and trust the healthcare system. I think those are the two biggest things in our country now: is the
Yes,
healthcare system
correct.
and the safety and trust of those in charge to look after you. Those
Definitely.
are the
Correct.
two biggest hills we have to overcome. Are those two things: safety and
Definitely.
trust and health. Yeah, that's what it is.
I guess we all want to leave this place better than when we met it.
Mm.
But there are certain things that hinder your ability to
Yeah,
change.
yeah.
Let me tell you something. You could give me $1 billion here in the U.S., and I will not still cannot let loose to know what's going on in Trinidad and Tobago, and leave it like that. There's no amount of money you can get to pay me to say, well, I will forget about what's going on home until and to neglect it. I have to do something.
You
I
You
have
know
have
what
to do
that's
something.
called, Gary? That's called Trinity to the bone.
Yeah.
Trinity to the bone.
I guess we
You
all
know,
are.
we have a young lady here. She's representing our country, and and Latifa Morris, Miss Universe Trinidad and Tobago. So we want to give her some support here. Give our children all the necessary support, and they venture out to represent our country, doing the right things. So I just want to let everybody know that she. I think the 21st of November is the Miss
Event
Universe contest.
Oh,
Yeah.
that's just
So
now. Wow, that's
yeah,
next
yeah,
week.
yeah, yeah.
next week.
So I just before I have been holding the picture and I keep forgetting about and doing it.
Yeah,
So I
she's
just
an
want to
attractive girl.
yeah,
Mm-hmm.
so we do want when the children is doing good things that they give them the kind of necessary
Yeah,
support.
Yes, yes,
absolutely. Yeah,
absolutely. Absolutely.
absolutely. Yeah.
Definitely. Definitely.
Okay,
All
boy,
right,
this is a
guys.
good time now. I have to
Yeah.
work tomorrow.
Yeah,
Yeah.
How are you
thank
guys?
you for taking the time, Fazia. So when Ken is ready with that design, we're going to upgrade and share some ideas with Ken, about that area with the beach area that Manzella. I think being here
Yeah,
from that
you know what?
area,
Yeah.
correspond with him and exchange some information.
No,
All right.
definitely. Definitely. And
Why don't you, Gary, send me his
Yeah, I'm going to send you his number. All right, I'm going to send you his
yeah,
email
number.
and contact number and stuff.
we'll
Yeah, and then
connect through WhatsApp and I could send you some snippets of the design
yeah,
and you
that
could
would
give
be
me some more
amazing.
insight with the
Yeah,
Yeah.
so
alignment and
you
the
give us
small
some
towns and
some
stuff there.
feedback on that.
Yeah.
But
Yeah,
Oh,
that'd
that
be
would
great.
be
That'd be
Ken,
that.
amazing. Yeah,
That'd be
that's
very
all.
next
valuable information.
next time
Okay.
you're in Trinidad, Ken, why not come down? We'll take a drive down that area and see.
Down
Sure,
to the beach,
definitely.
you come with your 4x4, okay?
Yeah,
Yeah, yeah.
I have a 4x4.
Very good,
Definitely,
very
I
Sivan.
good.
I
Definitely.
went there once in my lifetime in
Yeah.
2011. I went to distribute
Well,
computers.
we could always borrow
You
one of these
can
things for
go with that.
call an
But
Uber, call this
Well,
Uber
we do have
here.
a helipad up in the savannah where they hold the sports, so you can land it there on the helipad there.
yeah, in
But anyhow,
2011,
guys, yeah.
I went to
So,
distribute computers to the schools, the children laptop computers. I was in charge of the project
In
at the
beach area?
ministry. Yeah, right through Trinidad and
Oh,
Tobago.
okay.
I went to Beach, I went to Navet,
Mm-hmm,
RC
mm-hmm.
school.
So you went through the beach road then. So you know the beach
Yes,
road.
yes.
Yes, okay.
But I had a driver, so I didn't know the road. But
Listen,
uh,
if
yeah,
you don't take gravel on that road, you will have your guts puking out by the
but
time you get in that car.
the
Like so
countryside
bad.
was nice. Certain
Yeah.
places, some teak trees and so on
Yeah, the country is
along
nice.
the
And the
road.
drive is just the drive takes all out of the way. The drive is just terrible.
And
Yeah.
when I came back, I told my dad. He said, "Well, why didn't you stop by your uncle? I had an uncle living in Navet.
Okay.
He has a drugstore. Ramcoon is his name.
Okay.
The drugstore and so on." And he said, "Well, your uncle lives there. Why?" I said, "I never been there."
You didn't know that, yeah.
Didn't know that.
Yeah.
Yeah,
Yeah.
yeah. But it's a nice, pleasant drive. When you drive to the countryside, sometimes you get
You
a
know what?
nice,
That
pleasant feeling.
forest is very nice. And you know what?
Yes.
When you drive through the forest, because most of the streets is like the road is covered with the overhang of the forest.
Overhanging, correct,
Yeah.
correct.
And it's so
Yeah,
much cooler. Like you
cooler,
feel the
correct.
coolness in the forest when you come out in the plains, you can feel the heat of Trinidad. But in that
Yes,
forest,
yes.
it's so cool and it's so
This
pleasant. It's
is
such a nice
you're
drive.
absolutely right.
Yeah.
Absolutely right. Yeah.
Yeah.
It's like an
Mhm.
experience. So
It is,
why
and
not?
when the poetry flowers and it falls on the street,
Yes.
It looks like a wedding line streets with flowers. It's so
You
pretty.
feel like you're in Kashmir when I
Yes,
went
you
as
do.
well.
Yeah,
You see the
yeah.
same streets and
When
so on
those
like that.
when those flowers fall, but no, but now the
Yeah.
road is just so broken. Like cars don't even pass on the beach road anymore. It's too dangerous. There's so many landslides. I mean, if your car does go down, you're gonna fall a good 20, 30 feet into the precipice there, because there's no barriers, no nothing on this beach road, right? It's just a road. It was a dirt road back in my grandparents and my grandfather. They had one a little. So my grandparents lived just opposite the police station in Beach, Iso and Zaitun Khan. Like the Khans are well known in Beach. And they had the first little shop in Beach, and they had a shop during the war, so they used to have rations for all the goods.
That's the same thing, yeah, with
Right?
my
Just
dad.
for the police station, yeah. And
Yeah.
my grandfather, they used to walk that road from Beach to Sandy Grande to get goods to bring back to sell. They used to walk on, and that was a dirt road back in those days. My grandma told me a dirt road, and then they bought a donkey before they got a car, wherever when it was. But that road was a dirt road, and then it became, and then the Americans built that road. Apparently, during I don't know when it was they built that road, but Americans built it, I think. Oh my God, I'm confused now.
That's a
Either
wall.
Americans or England, I don't know, one of them. But the road was they made the roads very curvy, so they had more length, so they got more money for it. Was the reason why they had that road. That's what we were told by my grandfather. Yeah, the more road they had, the more money they got for it.
Yeah.
Well, hopefully we should address all of that
Yeah,
through a proper alignment.
yeah. But you know what? The terrain is not level. It's very
Yeah,
undulating.
that's
Terrain
not a
is very
problem. I
bad.
mean,
Yeah.
it's cut and fill, and and
Yeah,
build.
lots of landslides, lots of streams
Yeah.
run through. That road is
Yeah,
always
that's
falling apart. That road has never been fixed. Like
we
at
build
any given
we
time.
build roads in Florida here through the swamp. So
Man, I
Very
know.
good. Listen, Americans can do anything. We know that.
A mile a night, 1 mile
There
a
you
night
go.
from
There you go.
Biscayne Boulevard to Florida, the Intracoastal, 2 miles. And
yeah,
when I first went to school there in 1991, all of a sudden, next day, 2 days, entire road built from Biscayne right down to the ocean side, because
See?
the campus is on the ocean.
Wow.
Ocean
No
front.
way. Really?
Brand new road, brand
See?
new
There
highway.
you go.
Out there. Oh, gosh, man.
See, when you have things in place and you have a foreman who doesn't take 2 weeks to sweep a drain and then leave the drain pieces, dregs on the side of the road for the next week for the rubbish truck to pick it up. This is
Yeah.
what we have in Trinidad, right?
yeah.
The
Try
foreman
try
takes 2
try
weeks to
being on the
empty
try being on the payroll and not on the job. What about that part of it?
Well, that's another thing too.
I getting the biggest pay for the
That
man not
is
on the
it.
job. He getting the
And
bigger
not being there.
salary.
Yeah, not being
That
there.
is-
Correct.
That is a sweet spot, Gary.
Yeah,
Not being in
so-
the job and getting paid, man. That means you're on vacation.
So put your family too on the list. Yeah, for the payroll. Yeah. Anyway, we fixing up. We have a lot to fix.
Yeah.
Government is working very hard,
Yeah.
and Fazia, I deeply appreciate you taking the time from your hectic schedule.
No, that's
working in
okay.
the, in the hospital.
Gary, whenever I have time and you need me to come on, I will come on because I do. For me, I learn too a lot from you guys about, I'm not a politician by any means. Whatever I learn from people I talk to, and I'm learning a lot from you guys. And it's good just to keep abreast of what's happening and what's, what the vision is for our country, because it's about time,
Yeah.
And by the way, how your folks doing down here?
So.
Okay.
My mom is, she hasn't really changed much, and so
All right.
yeah.
So we might be seeing you for Christmas then.
Well, I really don't, whenever I get a phone call, my heart skips a beat, because I know I don't want to hear a phone
I
call.
know how that is. Yeah, I have been through that myself.
Yeah. So, well, hopefully I will see you guys one of these days soon. I have yet to meet Mr. Gary. I've known this man for how many years? He helped me so much during COVID time to get home, and I still haven't met this man.
Yeah, I definitely have to try real hard.
Oh my
Well,
God! One of
you-
these days I have to meet. Yeah.
Definitely we will keep in touch, and
for sure,
try to work that out. All right, so I'm gonna link you with Ken, and you could correspond in reference to the design and stuff
Yeah,
like
for
that.
Yeah,
sure. Yeah.
definitely, definitely.
All right,
Yeah.
good.
All
All
right,
right, guys.
guys.
So
All
thanks
Thanks,
right,
Roger.
everyone
Have a
guys.
for
good
Have
night.
a
Take
good
joining.
care.
night. Thank you so
Thanks.
much.
Bye.
Bye.
Good night,
Bye-bye.
everybody.